Father God, thank you so much for the privilege to approach your throne, Lord. That in times of stress and anxiety, uncertainty, fear, Father, we can bring those cares to you and we can trust that you care for us. And you've promised that when we've asked for your wisdom, that you'll give it in abundance. So I'm praying for that today for each of us, Lord, that you would give us a full measure of your wisdom and a full measure of grace for one another, that we'd be considerate, Father, of everybody's fears, that we'd be considerate of everybody's needs. And Father, most of all, I pray that you'd give us a spirit of unity, Lord, that you draw us together. There's been so much division in our country, Lord, and in our community. I pray, Father, that you'd bring us together as one people. And I just ask that you'd guide the direction of this meeting. In your name we pray. Amen.
Amen.
Do you want to say the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The Clay County School Board meeting will come to order. This is a workshop, July 14th, 2020, 3:30 p.m. I'd like to welcome citizens of Clay County. I want to take this opportunity to thank you for taking the time out of your busy schedule to attend today's school board workshop. This workshop is our opportunity as your elected representatives to collaborate openly among ourselves and make decisions that will decide the future direction of our public schools and the education of our children here in Clay County. There will be an opportunity for the public to ask questions at the end of the workshop presentation. Questions will be allowed. Public comment will not be allowed. If you want to ask a question, please fill out a comment card and hand that card to one of our deputies. Where are, oh, there they are. We will allow you to ask a question, but there will be no back and forth dialogue between the board and the questioner. Questions submitted prior to noon today via the comment link on our website will also be addressed during the public questions portion of the meeting. Your participation is welcomed and appreciated. And if any of you do want to fill out a card, just hand it to one of the deputies and they'll get it to me. Thank you. The first item, discuss reopening of schools plan. I will turn this over to Superintendent Brodsky.
Good afternoon. Welcome to everybody. Certainly there is no doubt that this is an historic time, an unprecedented time in our school district's history, in the state's history, and in the nation's history. And so there's no doubt that the opening of schools is something that we've seen in the news repeatedly. And we're all here today to talk about how to successfully open up our school district here in the future. And so that's the intent of today. Now, it just so happens to start off this presentation, we do have two experts that are on the line. You're going to have to excuse the technology of this because they're on the phone. And so we're going to move the microphone over to the phone. But we have Ms. Heather Huffman, who is the director of the health department, as well as John Ward, who is the Director of Emergency Management, just to provide an update and some information relative to where we are with the virus and some other information. So, Mr. Ward, can you hear me?
Yes, sir, I sure can.
All right, if you guys would go ahead and proceed. Can you hear me?
Yeah, hold on, we're having feedback. They got us on the video too. So there we go. Can you hear me now, Mr. Brodsky?
Yes, sir.
Okay. So through the chair, I just want to say, one, thank you for the partnerships. Your team has been phenomenal throughout this entire event. You know, when this started up, we weren't sure what the extent was going to be, and Mr. Brodsky and the entire team there has leaned forward and helped both with feeding and staffing at ESCs and all that stuff. So they've really been a part of this. So I want to greatly appreciate the school district. And I also want to thank Miss Vicky with the union. She's been reaching out and asking a lot of questions Still love her. We've had some spirited conversations, and I greatly appreciate her input that she's had into this. So I just want to say one thing to the entire team. This, unfortunately, is going to be with us for some time. This is a new virus, so everybody is still learning as we go. We're going to have to work together in this. Unfortunately, there's no playbook for this. There's a lot of plans in place for pandemics and that type thing, but this is so new. And as Mr. Brodsky stated, this is unprecedented. So we really need to work together as we put the plans in place. We're going to have to learn to live with this. This is going to be with us for some time. You know, everybody's thinking this is going to be over next month. It is not. We're posturing right now. This is probably going to be with us into the spring. So we really need to start looking and starting to what are new ways of whether it's teaching, whether it's day-to-day lives, whatever it may be. We really got to look at, you know, learning to live with this. And this, you know, everybody, and one thing I hate, and those of you that know me have had a chance to work with me, sometimes I'm a little too vocal, but this is where we all are on the front lines here. There's no one field, no one agency or anything like that that's on the front line. Whether you're a teacher, whether you're a fireman, whether you're a police officer, whether you're public works, no matter what you are, custodian, food service, everybody's on the front lines of this, and everybody's being affected by this. So we've got to learn to work together with this. So that's why I really stress we've got to take personal responsibility. So I'm going to talk about two things, and then I'm going to turn it over to the true expert, Heather, to talk about a lot of the data and stuff like that. So what I want to talk about is masks and the mandating of said masks. So we strongly encourage the use of masks, everybody, with a mandating of masks because of ADA, medical, and spiritual issues. There's not a lot of enforcement with it. So although it is great to say we mandate masks, there's no enforcement with it. So to strongly encourage, and this is where I'm asking our residents, school district staff, everybody, we've got to take personal responsibility in this and do this. Now, at any point, the BCC board can vote to implement this, but at this time, there's no talk of implementing that. We're strongly encouraged and I challenge to look at a lot of the areas that have mandated them with the exceptions and everything that's in place. So, and then I do want to add one thing, and I'm not sure if the cameras are up, but I was really hoping that, because I've got some little props here to use, but we've heard a lot of talk on face shields. So, Matt, one thing I want to say, and Heather's going to go into more detail, this is spread by water droplets that I exhale or you inhale. So it's that face mask that's preventing me from exhaling those water droplets and you from inhaling the water droplets. We're seeing a lot of people that are wearing face shields in place of masks. This does not work. Remember, it's water droplets, so if that face shield is covering my face, I can still breathe the water droplets up under my face shield. So you've got to have that mask on for that to do any good. If you've got a pair of glasses, if you're wearing glasses and a face shield, that is sufficient right there. But face mask and glasses, that is sufficient for protecting your orifices where you're going to breathe this in at. The face shield without a mask does not work. So that's about all I have to say on that. I'm going to turn it over to Heather and let Heather talk on her details, and then we'll be open for questions.
So first of all, thank you so much for having us here. We've been working closely with the school district, with Mr. Brodsky and Terry Dennis a lot. So the question I have for before we keep moving, is there a video showing or is this strictly telephone?
No, they're on video.
No,
You're on video.
We can see you.
Oh, okay. I just want to make sure if I showed things or I did hand gestures, you guys would know. So just to let you know where we're at data-wise. And so, you know, Florida's made the national news and not in a good way. And so we continue to monitor these cases. There's a couple of reasons that our cases have gone up. One is we have more lab capacity. We're testing more. But, you know, we truly have community-wide spread. What you saw in March and April is we did not do a lot of testing. We were only simply testing symptomatic individuals or individuals over 65, those kind of things. And so what we've been facing now is we're truly able to find within our community because we have all these open community-based testing sites now. Some of the urgent cares have come online, the private physicians' offices, and that. And so as of this morning, our total cases were at 1,602. I want to talk a little bit about the age ranges because I think that is very important to the school district. Our median age range back in March and April was in the high 50s, low 60s for the overall median age for cases. We are currently down to the age of 44. And when we specifically look, like example of all the cases, and it breaks it down into 0 to 4, 5 to 14, and then 15 to 24. And I know some of those 15 to 24-year-olds are not necessarily in the age group that you're talking about. Those are only about 300 of our 1,600 cases that we've had so far that are 24 years or less. So when we look at the number of cases, I think that's important for you guys to recognize that. The good thing with median age going down is we do know that based on the data that we've collected so far internationally related to this illness and this virus, is that it mostly impacts individuals of a higher age range, especially those 65 and older, and those that have underlying health conditions, specifically some of those comorbidities that we would talk about like diabetes, hypertension, cardiovascular disease, and obesity is a very high risk factor for those under 50. So when we look at that, we want to look at the data, but look at the data and do in comparison to other things such as demographics, zip codes, county data, and then also do comparison level at a national level. When we talk about deaths, we currently, as of this morning, had 39. That's only 2% of all of our cases. So if we talk about the number of cases we have, our mortality rate has still maintained around 2 to 3%. At one point, we were extremely high here in the county because it had hit some of our most vulnerable, especially ones in long-term care facilities. But right now, we're at around 2%. The flu has a little bit of a, I like to give it a comparison of a death rate. Flu is around, 0.5% to 1% each year. When you have Ebola and things like that that are extremely communicable, you can have a 70% mortality rate. So I'm trying to give you some comparisons so that you can use that. So that's where we're currently at in the county. We continue to have the community-based testing site located at our Green Coast Springs office at 1305 Idlewild, and that is open Monday through Friday from 8 to 4. And appointments are needed to go through the EOC conference call line to get those. So I'm just going to go over a few other things, and then I'll be glad to take any questions. I know this is a very steep learning curve. I've been in public health for 18 years. I'm a healthcare provider myself. And so even with this, because it's novel, we are all having to learn this together. John, have you learned a lot about public health since this started?
More than what I wanted to know.
Yeah. So again, the virus is transmitted through droplets. That is the data we have now. That is the evidence we have right now. We are learning more of this every time they do studies. They do retrospective studies looking at cases that have already happened, and then the new studies that are going on internationally. And so that is the data we know today, that it is droplets. And most of it is from that close, prolonged exposure that you would have with another individual. So within 6 feet, 10 to 15 minutes or longer. In this kind of instance with John and I, we've made sure that we've maintained those masks so that we know we're talking, we're exhaling. Those are moistures that come out. So we want to make sure that we continue to have that barrier between us. I did a little bit of research looking at data from some of the countries that have never closed schools to countries that had schools closed but then have since reopened because they're ahead of us. So we need to learn from them. And the data, and again, it's not evidence-based. They're one study here or retrospective study looking, just at this country or not. We're just not seeing any large outbreaks in the school systems, in the schools that have opened in the international countries. And so that's what I can find so far on that. And again, we will continue to research that and learn as much information as we can. Temperature checks, that continues to come up as many questions about temperature checks. Temperature checks is one of the screening tools in the toolbox. So when we first learned of coronavirus, it almost was the telltale sign of somebody having coronavirus. As we've learned more about this disease and this virus and how it transmits and how it reacts differently in different individuals, what we have found is in a lot of cases, we know so far that 1/3 of all of our cases are asymptomatic. They don't have any sign or symptom. No fever, no cough, no shortness of breath, no loss of taste or smell, no runny nose, no headaches. They have nothing. That's 1/3 of all of our cases. of the 2/3 that have signs and symptoms, fever may not be the one that shows up in that individual. And fever, what we're finding in some of these individuals, again, is only a shortened period of time. They may have a fever for 1 or 2 days, and then they're fine. So the temperature check, so when I go back to the temperature check and reading the guidance from the CDC, it is just a tool in the toolbox. And so that'll be something that the school district will need to decide if it's something they want to do or not. I'm not in a position to tell you you shall do or you must do or you're required to do. I'm going to provide the data to you so that you can make the best decisions for your constituents as the governing board for the school district. So if we look at the CDC guidance, again, some of the things that it talks about when it talks about temperature checks is asking parents to take temperature checks before the children leave the home. Because once they leave the home, there could be possibilities for having not the ability to social distance, which is one of our other protective factors. So if you do temperature checks, there's some things that need to be thought about. One is, when do you do the temperature check? So do you do them before they get on the bus? Because once they get on the bus, they are creating a congregate setting where they're going to be in less than 6 foot of the other individual, and they have the potential to spread it. And so we want to make sure that we're doing those beforehand. And then if you do them at school, who's doing them? And then one of the caveats that needs to be played in there is all the PPE that you're going to need to do those screenings. So the thermoscan temperature thermometers that you'll need, people need to be trained on that. They need to show competency on how to do those, because I have seen some people writing down that people were 94, 95 degrees, and that's probably not accurate. It wasn't done. The other caveat that we run with thermal scans is that if with it hot, and it's been extremely hot here, and in August it's going to be extremely hot, when you start to do temperature checks and people are coming from the outside environment, they will register high, and sometimes they have to go into the air conditioning for 10 or 15 minutes to be checked for a temperature for the simple reason that it's so hot outside. And then the last thing is the PPE that goes with those. So when you're doing temperature checks of children, and because you're that close to their face and the side of their temporal lobe, we want to make sure that those gloves are being changed in between every student. So those are some of the things that we need to consider when you're deciding if that's something that the school district would want to do or not. The next section is about masks. So masks are always, always, always strongly encouraged. That's been being said for a long time, especially through the governor, Governor DeSantis, and through the State Surgeon General, Dr. Scott Riske. Especially where social distancing cannot occur, especially in indoor places where ventilation may be poor. And so if you're outside, you're exercising, and you're alone by yourself, it's not necessarily necessary. However, if you're in these indoor locations and you cannot social distance, which we know is going to happen in the school setting, and we know that the ventilation won't be as great as it is outside, we want masks to be worn, and we were going to encourage that. Again, that's not my place to decide if they should be worn or they shouldn't be worn. That is something for the school district to decide. And John has already brought up those issues related to ADA accommodations and people with medical conditions, and how do you enforce that? Those are all the considerations that the school district is going to need to decide. And then the last thing is about contact tracing. And so we get a lot of questions on this. Under public health statutes in Florida, the Department of Health has a list of communicable diseases and other diseases that must be reported to the public health authority. And it's kind of a laundry list of those. And COVID is on that list now as a novel strand. And they not only have to report to us immediately, they report positive and negative tests, which the negative side is pretty interesting, because we've been able to see with public health surveillance how many true people are we actually testing. Typically, with communicable disease, we only ever see positive. I would have no idea how many people truly have been tested of something, because we never see usually the negatives. We only see the positive. So we've been able to do public health surveillance with this. How contact tracing works is when that gets reported by the lab or the provider as a positive case of COVID, we get reported into a database called Merlin. We start working that case. We call and we do an extensive interview with the positive patient or the patient's parent, if it was a child in this case, depending on the age of the child. And then we would also find out from them a history of 14 days prior to when they became symptomatic, or if they were asymptomatic, we would also check 14 days beforehand of those people that they've had close contact with, and those would include those people that have been within 6 feet of them for 10 to 15 minutes or longer. So we're going off of, as most histories and medical histories are, is self-reported data. What I've also asked of the school district as we've been talking through these reopening plans is some of the things that may help us with contact tracing. And some of the things that I have asked, and again, that would be approved by the school board or not, was assigned seating on buses would help us with contact tracing. Because just because one student tests positive on a bus does not mean an entire bus of students has to be then self-isolated, or the big fancy word of quarantine. I try not to use that word because it's a very scary word, but it's the same thing, self-isolation. Just as one student in a classroom may not mean that an entire classroom would then have to be self-isolated or quarantined. And what I mean by that is, if you have assigned seatings, and we're not going to, it gets a little bit variable when you talk about primary schools, elementary level versus high school or middle. So a child that's in a classroom and the math teacher is teaching at the front of the room, she may not, one student in there tests positive, but that person sits in the upper right hand of the classroom, and this, all the other students to the left. We would probably just need to do that 6-foot radius to look at that exposure radius that we're looking for. So we don't want to self-isolate individuals that don't need to be, but we do want to isolate the ones that do, because people will get quarantine fatigue, and we don't want that to happen, and we want to identify the people that truly have had an exposure. So lots of information that I've given you, a lot to absorb, and I know you have lots of questions, and I can't see you guys, so I'm hoping that I'm not just talking to a brick wall or anything out there, and I'm glad to answer any questions that I can.
I've got, just to add one thing in before we go to questions, and this is to all our folks out there, and just to encourage to always go to the official source for data. Alert.claycountygov.com is where we've got all our links. CDC, please go to official sources. We've got a lot of Facebook doctors out there and a lot of Facebook experts. Please go to the official source, or if you have any questions, please call 877-252-9362. That is also where you can schedule for your test Monday through Friday, 8 to 4 at the health department there. And that is 877-252-9362. We'll open for questions now.
Any board member questions? I do have one. I have one question. Heather, could you please kind of review the HIPAA and FERPA laws related to the medical information for students
Sure.
or faculty?
Sure. So I'm going to take my mask down just so I make sure you guys can hear me really well. John, make sure you're so HIPAA is really, really important for personal health information. And if we don't do anything right, that's the one thing we do need to make sure we get right in this. So HIPAA does not allow me to disclose anyone's personal health information without their written consent. So, but there are a couple of caveats that work in that, and I've talked to our attorney about it just to clarify it recently. So if I have a staff member, that's at the school district and they test positive, I'm not going to share it with their employer. I'm not going to even share it with their spouse unless they give me written consent. So it's the same when you go into your doctor's office and you sign that paperwork and it says you want to disclose your medical record, and you may list your spouse's name on there or somebody that maybe has healthcare surrogate or something for you. But otherwise, we don't have permission to give that to anyone else. There's a couple caveats related to HIPAA. I can, as a medical provider that holds medical information, be able to share that with another medical provider for continuity of care. So, for example, you currently see me in my clinic, and then you now want to go to another doctor. We can share that information, or you're seeing a specialist. We can do that under continuity of care. The other caveat that comes with HIPAA is when we have outbreaks. So for public health significance or to stop the spread of a communicable disease related to an outbreak, specific outbreaks, then we can release that information as they need to know in order to stop the outbreak, but not in a people feeling like they need to know. I want to be very clear on what that is. Does that help answer the question, Mr. Bosky?
It did, but one of the things that's going to happen is people are going to demand to know information, and they're going to want to know information. And so, what is your thought? What's your advice? What are you going to tell us related to that? Because as soon as somebody is test positive, everyone else is going to want to know that information. Could you please clarify?
So I provided Terry Dennis, the Chief of Staff, with a couple of infographics that have come from the Florida Department of Health. One is COVID-19. So you've tested positive, now what? It talks about some of the precaution and the self-isolation information that we've talked about that we will give those individual patients that have tested positive. But then at the bottom, it also talks about informing your close contacts. So individuals can do that individually. If it's my personal health information, I can choose to share that with whoever I want. However, as the provider of that information or the holder of that information, I don't have the right to disclose that information. So I wouldn't be able to say student X in this school has it because it would be identifiable. I don't have the authority under the law to provide that information. The individuals themselves can say, I'm going to call my 3 people that I know that I sat in lunch with, and I'm going to let them know. But I, as a medical provider or the public health entity, don't have the right to share that information.
And that also, if I could add into that, that also goes for any school staff either. So little Johnny's parents called the administrator and says, hey, my son has tested positive for COVID. That administrator, that teacher, whoever they contact, has no right to notify anybody else. Again, that's a violation of HIPAA in there. As far as the purpose, sir, I'm going to defer back to y'all on the purpose side because that's that educational piece. But as far as HIPAA, if you're notified, you have no right to tell. Now, it's going to be pretty obvious when little Johnny's out for 14 days what's going on. But if there's anybody else that's been in prolonged contact, they will be reached out by the Department of Health and notified to do the 14-day self-isolation. You're probably going to have other parents that are going to pull their kids out when that rumor gets out. But as far as any teacher or administrator, doing a school-wide notification or something like that, they have no right to do that.
And John brings up another point. I just wanted to go back to the temperature checks. There also has to be a log of those temperatures, and then you have to maintain that data as if it's confidential medical information. So for the students, it would have to go in their medical files. For the teachers, it would have to go separate in their medical file, separate from their personnel file. So all of that data, because you're collecting it, you also have to maintain it as a medical confidential file.
Heather, I have a question for you. This is Janice Carrick, a school board member, District 1. Is it my understanding that you're not recommending temperature checks at all? That you're recommending parents do it at home and that's it?
Okay, so I'm not making any recommendation. I'm providing the data to you so you guys can make your decisions on which way you do. It is one of the tools that's in your toolbox for screening for COVID-19. This is the same as if you had students fill out a questionnaire that said, have I been around anybody with COVID positive? Have I had many of the signs and symptoms lately? Shortness of breath, fever, cough, loss of taste or smell. Have I traveled anywhere where it's, community-wide spread, which we have that already here in Florida. So I'm not making any recommendations for or against. I'm simply providing you the data that it is, as far as temperature checks, it is one of the available resources in your toolbox.
Thank you.
Let me ask something. This is Carol Studdard. You were talking about if a student got sick and the HIPAA regulations, if a teacher was to get sick, does the same thing play that the children in the class would not be told that the teacher had tested positive or whatever? I mean,
You're correct, ma'am. I would not be sharing the teacher's personal health information also.
Okay.
Now, the teacher may share with her employer because we have a lot of employees that share with us, but we still have to maintain their confidentiality when they say that and who we share that information with.
Okay.
And so it's always important I always try to use, COVID is novel and it's new and people are trying to learn it and we have a lot of anxiety with it. But when we talk about personal health information and the sharing of that information and the confidentiality of it, that hasn't changed from other communicable diseases. So it's the same as if somebody had TB or HIV or some of those other communicable diseases, we wouldn't share that with other groups of people.
Okay. I think Ms. Bola has a question.
This is Mary Bola. I'm following up to Carol's question. If a student, for instance, has COVID, and you indicated that you would want to basically follow up with the students that are around that child within a 6-foot radius, have sat with that person for 10 to 15 minutes, could include the teacher as well. Do those students then have to quarantine for 14 days, or would you recommend testing, and if they are negative, to be able to come back to school?
That's a great question. So the transmission and the incubation period with COVID is around 2 to 14 days. So if we have a student that tests positive, and I contact three other students that who they say they've been around, they've identified it, or we've looked at a seating chart because, you guys are going to help us try to do that contact tracing. We don't even identify the student when we call. We would just say you've been identified as someone who has been in contact or had prolonged exposure with a COVID-19 positive. We will ask them to self-isolate for 14 days. The problem with getting a negative is if they were exposed yesterday and they go today, they could be in the process of that virus building up in their system, and they will actually test negative. And that's why we can't just simply have them go and get a negative test. Because it may take to day 14 before we even can get a positive on them. So the 14 days is a must when they've had an exposure. That's a pretty clear-cut period of time. People test differently. We are actually not testing for the virus itself. We are testing for the proteins that it sheds. So when I do a nasal pharyngeal or an oral pharyngeal swab on them, I am testing for the proteins that virus is shedding. So we need the virus to build up in the person's system before we're testing them so that we're getting an accurate test. A false positive is highly unlikely. A false negative is more likely in the sense that we didn't pick up proteins in that specimen collection. And so that's why we don't use a negative test, a single negative test, to rule out someone and let them go off of self-isolation. We do basically a non-test-based strategy and do the 14 days.
I have a question. Heather, the question I have is back to the temperature checks. Would it be wise to send like some guidelines to parents, just like you were talking about, like don't test them after they've been outside in the heat and those kinds of things, so they would know to get an accurate temperature measurement? Because it would seem to me that if they could do that prior to coming to school, that would at least be like you said, a tool. I mean, it's not, not one way or the other, but that would at least give them some ideas too. Would that be a better thing possibly than waiting until the kid comes from school to school?
Well, again, it's a tool in the toolbox. I think you've got some other hurdles if you decide to do it at school or on the bus. I think you have some other hurdles to go over versus the parent at home doing it. Again, it would be self-responsibility that the parents are doing it, but it's also, it's never harmful to educate people, especially parents, and give them. We don't want to make the assumption that they know how to take those temperatures, especially if they're using thermal scans and stuff like that. Sure. At home, they may be using an oral temperature or thermometer, and those are fine in their homes where they can disinfect them and all that. Of course, in a public setting, we don't use those types of infection control practices. But anytime we can provide education to parents, if we're asking them to do something or encouraging them to do something, if we can provide guidelines or education on that, that's always a great avenue to go down.
Thank you.
Heather, can we require people to take a test?
No, I can't require anybody to take a test unless there was some kind of order from a judge, and those would be extenuating circumstances. So for something like COVID, I can't imagine that would be that way. I've seen that only a handful of times in my career in public health, and that's usually been related to HIV or STD status, and where there's been a sexual assault or something like that has come down from a judge's order to have someone tested. I've not seen that in COVID.
Are there any other questions from the board? Mr. Brodsky? Okay, thank you so much for the information.
And you have wonderful staff, or your staff, Mr. Brodsky and Terry Dennis have, I think I talk to them at least once a day, sometimes more often than that. Really reaching out, and they're wanting to learn. And I'm definitely not the expert. I have a little bit of I'm up the mountain a little bit further than them in public health. But, we're a team. We have a good partnership. And, I'm here to answer any of the questions, and they'll tell you, if I don't know, I tell them I don't know, let me find out for you, let me research that a little bit more. And in some of the things, we just don't simply know all of the answers yet. We've learned a lot, a tremendous amount in 4 months. I think we're going to be look very different even in 4 more months. And, we're still hopeful for vaccination, but, I think we always can be hopeful and optimistic. But I think we have to live within the parameters that we have currently.
And just in addition to that, I think everybody, and again, I want to go back to everybody that's watching this, everybody that's on a social media outlet, all the kids, moms and dads, district staff, I don't care who you are, whether you're food service, custodial, teachers, aides, and administrative staff and district staff, we're all working at this together, and we've all got a partner to get through this together.
Absolutely. We must all work together. Did you have any other comments that you would like to make? Okay, thank you so much for the information. Have a good afternoon. Okay, Mr. Brodsky, I'll turn it back over to you.
Okay, while the presentation's going up there, a couple things. One, I would just echo what he said about the partnership with emergency management and the health department. When we went down this journey of shutting down schools back in March, we all knew eventually it was going to come to the point where we talked about reopening schools. And I will just say that it's been a rather challenging event to plan for the opening of schools. This district, I'm proud of the subcommittees that were formed. Many of the leads of those subcommittees are here today in the room to provide expert testimony if needed. On those subcommittees, we also included not only the director of the health department, the director of emergency management, but 2 different epidemiologists, nurses, teachers, administrators, support personnel. Truly was a team effort. And even with all of that, you hear the director of health say to you that she doesn't know all of the answers. Okay? So the purpose for the workshop today is to provide information, gather some additional information relative to the reopening of schools. I put together a little presentation that I'm going to go through here. I'll answer questions at the end of the presentation, but it's going over some of the basics of what we covered. The document itself is much longer, and there's many links to it. I will say this, there's 35 districts that haven't put a plan on the internet yet. Of the ones that have, our district, our plan that's out there right now is rather lengthy and very detailed. Even with that detail, I received, I don't even know how many emails, ladies. How many would you say?
I don't know.
200? 200. In addition to that, when we launched the parent portion of this, they had the option to go in and ask questions. At last check, there was 386 questions in that log. And so there's no doubt that there's going to be many questions. That's the point of that little soliloquy. And so the point would be to gather information today, to readjust our plan as necessary, and to move forward with the very best plan that we can when it comes to the opening of schools. And so with that, I'm going to kind of go through this presentation. So today I'm going to talk about a couple things: the Smart Restart program, the 4 options that parents have, because I know parents are out there, and parents are wondering about some of their educational options and what they have. After that, I'm going to talk a little bit about what the data is showing relative to what parents are choosing, because at the end of the day, when it comes to what services we provide, it's really data-driven related to what parents choose for their families. Going to talk a little bit about enhanced cleaning procedures. And then at the end, that's where we're going to talk about the use of face coverings, the use of temperature checks, and all of those topics. I put it all at one time for all of the topics that need to be discussed and decisions that need to be made. So with that in mind, the 4 options that families have, we launched the Smart Restart last Thursday afternoon. And one of the things that I'm proud of is that we provided families with options. No matter what we say at this workshop, no matter what we put in the plan, no matter what we put on the internet, it's really up to families to decide what is best for their family based on their personal situation. And so we're proud of the fact that we offered 4 different options. Are these options perfect? The answer is no. Are there going to be questions about how these options apply to individual students? The answer is absolutely yes. That's why we had 380 some odd. It's probably up to 400 now. And we're carefully working through each one of them. I believe we resolved almost 300 of them at this point. We obviously are going to answer all of them by the appropriate time. Many times parents have very specific questions. My child is in this particular program and they can't take this course. What do we do about this option in this situation? So very specific. And so we are working through all of those. Parents that are out there listening, we'll answer all of those questions. So the first option that we put in there is an option that's actually in the commissioner's executive order, which came out on Monday. So we originally had a plan. That plan was involved a hybrid model as well as some other things. And then when the executive order came out, it forced the team and the task force to get back together and say, how are we going to adjust our plan? One thing that is clear from the executive order, in my reading of the executive order, is that school will be offered to all students in the brick and mortar fashion 5 days a week. I think that's pretty clear in what was written into that order. So a couple things about the brick and mortar. I would just say that's traditional school, the way you know it, but with additional safety and health protocols in place. And so we're going to go over all those here in a minute. But one of the things that we asked parents to do was to fill out a transportation survey relative to whether or not their child's going to go on the bus to be transported to school. So brick and mortar, some of the safety precautions, like probably 30 or 40 emails that I had, were all about what safety precautions are in place. What are you doing differently at your schools that will give me some reassurance that there's less risk involved in sending my child to school? Well, there's many different things. One of the things that I would quickly point out is that each school facility is different. So when you're talking about things like social distancing, how to run lunch, how to do hallway movement, how to do all of those things, it looks slightly different at one school than the other. So each school has the opportunity to meet with staff, their CCA rep, and other faculty members, and we asked them to do a bunch of pre-work related to their school. So, for example, the cafeteria itself. Let's just kind of go through this. Okay, the cafeteria itself. How are you going to maximize table spacing in order to get social distancing in a cafeteria? Well, that really depends, right? So, for example, and I can only use schools that I've been to. Middleburg High School, for example, has the gymnasium right next to the cafeteria. There's also 2 potential outside eating areas at Middleburg High School. If I was working with my faculty and staff about how to run lunch at Middleburg High School, it would look different than Oak Leaf High School which has more students, although Oak Leaf High School has a little covered area when you first walk into the building. My point is not to go through every school facility, but I think it's important that the people that work at that facility are part of the planning of how to do that. In addition, in the cafeteria, one of the things that Ms. Huffman had talked about was you need to have a seating chart. So unfortunately, assigned seating in the cafeteria has to happen. The reason why it has to happen is because if there's the need for contact tracing, that would provide the opportunity to know what students were in potentially in prolonged exposure. That's 15 minutes of potentially 6 feet or less. So staggered arrival and dismissal times to the cafeteria is another discussion item that needs to occur. And lunch line procedures. How do you get them to stand 6 feet apart, going to get their lunch, etc.? That picture, by the way, was taken this week, I believe yesterday. Was it yesterday? We took a little tour, went out there and saw what does it look like in school right now. You know that we had started athletics back 2 weeks ago, or maybe it's 3 now, and we started our summer program. So these are the rising students that coming in there. You could see the students in the cafeteria right there. Of course, one of the challenges in a cafeteria setting is you have to take your mask off because you're eating, right? So that kind of is a good look of spacing in a cafeteria that was taken yesterday.
Mr. Brodsky, do you want us to interrupt, or you want to finish the whole thing?
Well, how about I work through it and then
Okay,
we'll
all
go from there. So cafeteria, lunch line procedures, all of that stuff. Classrooms, desk spacing. So how you space the desks becomes important because you can't achieve social distancing unless you really work to figure out the maximum way to distance students in the classroom. Unfortunately, that means removing some of the stuff that's in there that people like to have, whether it's book nooks or couches or those kinds of things. We're all going to have to realize that the world we live in now is different than the world we used to live in. And so I think most teachers know that, when we do come back to school, the way your room looks will be slightly different so that we can achieve maximum social distancing in the classroom. The picture on the right is in the same program. That's Charles E. Bennett Elementary School. Now, granted, there was only 20 desks, in the room, but the room was big enough for social distancing in that example. Okay. So the health rooms, how do we handle the health rooms? Well, one of the things that was suggested in several plans by the government is an isolation room. You have to have a separate space in order for students that have COVID symptoms. So what does that mean? We need to identify another space for the normal nurse events that occur. So each school would develop a plan for where is the isolation room going to be, where students are going to go. And then we'd need other folks in order to help out with routine kinds of things. Sometimes students want a Band-Aid, they want ice, they want all kinds of stuff, right? And we would have to send out a list, and actually there's a document for this, of like when to send a student to the nurse, right? Because now it's a little different world out there relative to the virus. Then we have large learning areas. We have things like band, chorus, music, the media center, PE, the computer labs, right? When you think about all of the planning that has to go in order to make our environment safer, it's kind of mind-boggling now when I'm going through this step by step. You can see that if you're on the leadership team, the CCA rep on that team, or whoever you are, you're thinking, how do we do this? Like, how do we make this the best possible environment for our students and staff? I will tell you that Charles E. Bennett, I saw some things that I thought were kind of neat. They had stickers, and they weren't on the floor. They were on the, what is that called? Baseboard. And the thought process was, and I never thought of this, if you put them on the floor, the kids are going to rub them off. But if you put them on the baseboard, they stand next to where the sticker is on the baseboard. I watch students in action. I can tell you that students, students take the direction of adults. We can do that, and find the best possible way to bring students back. And so all of those things have their own protocols. Let's just take band. Most band rooms usually have one room that holds all of the instruments. So now if you're the band instructor, how do I have students get their instrument, but not all at the same time? So now things that we've never thought of before as individual teachers in the classroom or principals, administrators at the school, all of that now has to be thought out and planned, right? So this is a major undertaking. When you take a look at other transitional spaces, how do we handle the bus loop, the parent pickup, depending on where you are, the bike rack, before and after school, the athletic fields and playgrounds? What's the plan for that? Recess. That's another opportunity there. The hallways, one direction in those with staircases is one staircase. The up staircase, one staircase is the down staircase. How do we do all of those things? Transitions to classes, athletics, extracurricular activities. We're already involved in that process. Okay? So I just want to point out with the brick and mortar that it's more than just, okay, people go back to school. There are deliberate planning that has to occur to maximize or lessen the risk towards students and towards staff. Now, at the end of the day, will all of this be perfect? Absolutely not, right? So I just kind of honestly just come forward and say that's not going to happen where there's a perfect scenario. But I know that everybody that came to this meeting knows that, right? So it's about how to do it to maximize it is what we're talking about in the brick and mortar. So the second option that we're giving parents is CVA. Clay Virtual Academy has been online since 2010. It's an A-rated school within our district. They do a great job. It's different, though, than what parents experienced in distance learning, okay? So I'll just try to give an honest assessment. In distance learning, please remember that was us being thrown into a situation on a Friday afternoon in which we shut down an entire district. I sometimes refer to distance learning and what happened at the end of the school year as crisis learning. We were forced into a crisis. We did the best we could. And I'm proud. I'm proud of our teachers. I'm proud of how our parents and our students adjusted. But that was us having to work very quickly to have distance learning occur. CVA provides that same form of flexibility in schedule, right? Because you don't have to do the assignment within a prescribed time frame, but you do have to do the assignment, and it's rigorous, okay, to do. And it's graded, attendance, all those kinds of things. So it's a little bit different. There is a registration form that parents would fill out relative to CVA. What I found out, though, in this whole process, just by the sheer volume of information, has been overwhelming. And I don't know how board members feel, but the number of emails and phone calls and those kinds of things have been a little overwhelming. One of the things that I think we did a good job on when we unrolled the plan was putting a frequently asked questions in there, because many times it's the same question over and over again that comes up. So if you have questions about CVA, I want to encourage you to look at the frequently asked questions that CVA has. It's on our social media. It's also on their site relative to that. We do use the Florida Virtual School curriculum, so it's a recognized research-based curriculum relative to that. If you have questions, you can email CVA at myoneclay.net. And also at the end, I'll share the website for questions relative to the whole reopening of schools. So CVA. So how many people
I
signed
don't
up?
mean to interrupt you, but just let parents know if they do that option, they're not locked in for the full year.
Yeah, it's one semester. Okay, we're asking for a commitment of one semester. So if I could, let me kind of go off of all this whole topic here to say that one of the things we're going to have to do is provide excellent service to our customers, to our students and our parents at the end of all this, whenever we do return back to school. And so having that knowledge, having those numbers is important, right? Because when you take a look at the number of students that signed up for CVA that are up there now, okay, and I just want to emphasize to parents that I know it's a difficult decision, but at the same time, I'm also asking for your help. Okay, I'm asking for your help in the sense that when you decide to sign up, that's great, but we want to go ahead and provide good service, and we need to know those numbers in order to provide good service to you, right? So when you look at the number of students that have signed up, you can see the chart that's up there, 2116. So that's roughly 4% of our elementary parents have said, I want to go to CVA, 11% of our junior high parents, and 6% of our senior high parents have said that.
Now, when was that date?
So that was today. Today.
That's up to date?
That's up today. Well, a couple hours ago, 4 hours ago, whenever we put the chart together. But that's now. So let's talk about what that number means.
Mr. Brodsky, do you happen to know the number for Florida Virtual? How many are planning to use that instead of?
Don't know that. Okay. Don't know that. So let's talk about 2116, right? And when you look at 2116, I don't have the number of students in each. Otherwise, I could tell you maybe it's 7-8%, depending on which group is the largest, right? When you're figuring out total percentage. But when you're talking 2116, that's the equivalent of opening up a new high school in Clay County, right? So I don't know if everyone has an appreciation for the idea that now you're converting a whole system. You've just opened a new high school, right? And then the question would be, some of the questions that remain is how to move allocations and move teaching to that new high school all within this time frame. So I'm hoping you can kind of see the number and appreciate the complexity of it when it comes to CVA. So OneClay Online is another form of online for our K-6 students, in which they'd still be attached to their school, but they're going to have a defined time in which learning would occur. So pretty much from the morning time to the time that school ends, the student would be expected to be doing things relative to their education. The teacher would be at the brick and mortar school. The teacher would assist in the learning. Attendance would be taken. Let me put your mind at ease, because I did have a couple of these emails, which was, is my child going to sit in front of a computer on camera for the full 7 hours? The answer is no. But one of the challenges of distance learning, when we put that together in the spring, was everybody was going at a different pace. And I think that I would argue that some teachers, their pace was very, very quick, and they were all about it and did an outstanding job. And then some teachers maybe weren't as rigorous enough in that process. And so when we're talking about the OneClay Online option, we're talking about a more rigorous venture when it comes to distance learning. One of the challenges that we have as a school system, and really, is the loss of learning that has occurred during this time. We've always talked about summer loss, summer learning loss, but now we're talking about 6 months of loss, right? So it's going to be incredible how we have to make up some of that loss and how to do that. both in the governor's plan and you could see that roughly 1/3 of his 146-page document was all about learning loss. How do we bring students back? How do we get them on track academically, and all of those kinds of things. So parents, if you're looking for a defined time frame for learning and you still want to be attached to your individual elementary school, then this would be an option.
This would be the same school hours as a brick and mortar student?
Correct.
Okay.
Correct. So it provides structure, in other words. If you don't want structure, if you don't want a defined time, then CVA is a better model for you. But all online learning comes at a cost in which, one, you notice it says as well as an adult who can partner with you, right? So it does require some parental help pushing to make that learning happen, because I don't know about you, but I've had 2 children, and if I said just go there and do that, that never happened, ever.
But this would require someone to be at home with that child.
I would say so. In order for the learning to occur, you're going to need,
If mom and dad both work, this isn't an option.
that would be very difficult to have that option. Yeah.
Can I ask
So-
a question before you move on? Again, the timeline for that one would have been each marking period and not semester. But for our teachers who should choose that option, are we going to have any additional training for them? I know Clay Virtual, you said that if they transitioned to Clay Virtual, there would be plenty of time to have the training to be up and running as a full virtual
Right.
teacher. But I know distance learning was really difficult for some of the teachers. And what additional training will we offer for the teachers who choose that?
We're going to provide additional training, but I'm going to back up one step more, which is, I'm talking, solely about the student piece of this, right? But then we need qualified educators to do the teaching part, right? Which is a whole nother side of the house. And so when you look at teachers, we had, and I don't have that data here, so far of the teachers that responded, we asked teachers, would you prefer to teach this particular environment? And we tried to describe it, hey, it's brick and mortar, it's defined time frame, all of that kind of stuff, or CVA. We asked for that information, and it's less than 100 on both of those, the CVA and the online version. I don't have this exact number here. So one of the challenges is, right, you have the high school 2116 with CVA. You have the numbers I'm about to show you in the next slide for this. So it's like opening up 3 schools and moving staff around to make that all work out, right? The bottom line is we need to do what families feel comfortable with, because we are in a super unusual time, right? But you can see the complexity of getting that job done. So training of these folks is going to have to happen.
Right.
For
Can I
sure.
ask one more question?
Yes, ma'am.
How many of our teachers responded to the survey? I mean, we've got what, almost 3,000 or
We've got
2,800?
2,700 teachers roughly, and last time I looked, it was 1,700
Very good.
that responded.
And then for the parents, did we have a large response, or they waiting until after this workshop to figure out?
I don't know. I don't know if they're waiting until after the workshop. If they're going brick and mortar, which is the majority, they don't need to
Right.
put a response in. So it's hard for me to quantify that.
Well, for those that have chosen, or that we're hearing from, and we can all say, we've heard a lot say they don't even want to go back. How many from parents would you say we've received? How many surveys back, or?
I can just tell you from the numbers that we have here, the vast majority are looking at brick and mortar, and you're looking at about 9% total. Keep in mind, you still got 2 more days to go. So I mean, don't hold me to that number, but
No,
if
I
you
won't,
want
and I was
if you
just
want a
wondering.
general sense, that's where
Yeah.
we're at.
9%.
Of the total population is choosing a virtual option
9%.
at this point. So
9% of our 40,000 students?
Yep.
Yeah.
Okay. Thank you.
So here you go. It's broken down by by grade level. We just thought that'd be kind of interesting to say, what are they kindergartners? And you could see as the age goes up, the virtual option becomes more relevant, maybe because the student is more able to do it themselves, kind of thing, but that's kind of where we are. So that percentage of total elementary is 6%. So that's kind of where we are. So 1139 is most definitely a large elementary school. 2119 would be our third largest high school. So that's what we have going behind the scenes right now. So one of the things we wanted to do was also provide an option for parents that were 7 through 12. And so blended learning is the opportunity to go to the brick and mortar school for some of the periods and then go to CVA for the others. So a parent might choose to go to their electives, for example, which are difficult to do on an online format. There are some courses and coursework that are also difficult, and as a result, a parent might do some mix and matching of online and in person. Now, let me put some caveats into this, right? Because there are logistics that can't be overcome. So I'll give you an example. Some of the scheduling, when it comes to scheduling all of these people with all of these options that they would like, may not be possible. For example, if certain courses are only offered certain periods in the brick and mortar, it may not be possible for a parent to have their child go to school for periods 1, 2, and 3, and then go home for periods 4, 5, and 6. Okay? So I want parents to recognize that this is an option for a little bit of blended learning, but it may not actually work out in your favor depending on what coursework you're talking about. Let me just speak to ACE, IB, and AP, okay?
Please, we've had lots of questions about that.
We have, and Mr. Daly is our ACE expert in the crowd. He's talked personally to 50 parents yesterday to kind of provide some information. So in the case of ACE and IB, they are very rigorous academic programs, but they do not have an online version of their curriculum.
What about Cambridge?
Cambridge is the ACE program, and they don't have an online program. Neither does IB, right? AP, which is College Board, does and has for years, right? So one of the challenges there is that the ACE teachers and the IB teachers require specialized training in order to teach those courses. In fact, I believe IB has like a certification type of thing with their teachers. So if the teacher is teaching in the brick and mortar, they can't be teaching in the brick and mortar and the online at the same time, right? It just can't happen. But there are ways to keep a rigorous schedule. And so I'm going to throw 2 names out there for any ACE parent that's out there listening. For ACE at Oakleaf High School, it's Nikki Knight, and she is the ACE coordinator there. At Fleming Island, it's Gina Davis. She is the ACE coordinator there. We've prepped them for every possibility for your child's schedule. But remember, this would only affect the ACE and IB students that don't want to go brick and mortar, and they're looking for some sort of virtual option. That's what we're referring to here. So there are other courses that wouldn't be able to. For example, just to kind of throw some wild ones out there, if you take carpentry at Middleburg High School, there's no online version, of that. And so when you start thinking courses, not every course can be done online. So I'm hoping that that parents, when they look at this and they think about it, that they realize that it would be impossible for us to offer an online course for everything. When you get to the secondary level, there's more certifications too that go into the mix. Like, how do we get people that are certified in all of these topics? So That's one thing I would say about blended learning. The other thing I would point out is that we asked for some patience with the guidance counselor, right? Because the poor guidance counselor, here's what you want, and then they know what they can pull off based on the course scheduling that's on the computer, right? So I just want to give those caveats for it, but transportation is not provided by us. So that's another thing that I would point out to parents relative to blended learning. And there really is no perfect option when it comes to this. We've never been in a pandemic before attempting to convert the system.
Ms. Bola?
But if they are going to school in the morning, they can take transportation. But if they are deciding to do the blended learning in the afternoon, they would not necessarily have a bus ride home. Just clarification.
That's correct. You can use the bus in the morning, and whatever time you're leaving school at that point, if your parent's able to provide transportation, you can do that. So there are options that are out there for parents, but I just wanted to preach patience. You know, as a person that's been a high school principal a couple times and a junior high principal, I can just tell you that the complexity of trying to make it all work out for everybody would be challenging, okay? Just some comments related to that. Example, a parent or student works with guidance on course selections that are available both in brick and mortar and via CVA. The schedule is designed based on course availability. So it would be very difficult, and I hope a parent would recognize they can't say, well, move my child's English class to 6th period. I want them to come. That would be very difficult to accomplish. If it's able to be done, we'll be glad to accommodate, but it'd be very difficult for that to work out. Okay, so those are the options that parents have. We're asking parents to make a selection. We know it's difficult, but we also know that hopefully you heard some of the enhanced protocols that we have, and now you're going to hear about cleaning here in a second. So in making that, I kind of, one of the things that I found very interesting about Facebook, and I'm not a big Facebook person, but you know, I kind of did watch the comments when we first unveiled this. We had a meeting with teachers there for about 4 hours. I think we met in that room over there, and then we released the information. And I said, well, I'm wondering what's going on. And I found it very interesting because parents kind of patrolled themselves on Facebook and kind of pointed out, hey, look at the FAQ. Hey, look at the website. You know, here you go. It's very complex, and certainly would be willing to answer any question that's out there. And I still have about 27 more emails to go, but
Is that all?
that's it. But I just want to point out that that it's kind of a complex process, and sometimes, you know, I think when I was listening to, not that I was listening to Mr. Daly's conversation, you had to be in the same room talking to a parent about an ACE situation, and he did a masterful job in a 15-minute time frame of bringing the parent around to the ideas and the complexities of it. And at the end, it ended really well. And so I think that more information provided to parents, the more parents will recognize their situation and how we can make the best for their situation, even if it's not perfectly the way they envisioned it working out, right? So just to kind of go into an entirely different topic, let's go on to cleaning. So one of the things that you know, I've heard consistently through the emails and through conversation is, how do we clean? Because I realize that people are concerned about the use of face coverings, they're concerned about social distancing, and they're concerned about cleaning, and that seems to be the big push, and I understand that. So let's talk about options of what we can do to enhance cleaning. A couple options of what we're looking to do is, one, rework our custodial shifts in order to ensure cleanliness throughout the school day. So many times, depending on the number of custodians that are assigned to a school, the hours that are there, we are going to need to have more of them there when students are in session. One of the reasons for that is because you'll see about the fourth bullet point, we want to go ahead and hit the high touch areas throughout the day and have routine cleaning periodically throughout the day. I talked to principals and I said this, and I think it's safe here to say this because they tell you I'd say it to them. I said, the things that you thought you were in charge of as a principal before are totally different. You now are the person in charge of the cleanliness of the restroom, the stocking of the supplies, personal rapport with the custodial staff. This has now elevated to such a higher priority than it ever did before. Well, guess what? We're in a different world. So if you're in a different world, you have to behave differently. And so that message has been thrown out there more than once, as a matter of fact, to administrators at a school. So the details of how to do that is really where principals need to be involved in that whole process. One of the things that we did was we have ordered hand sanitizer for every classroom. That's already been there and it's been distributed, as well as additional soap and cleaning products for all restrooms. The common restrooms need to be restocked and cleaned periodically throughout the day. There needs to be a checkoff list for that to occur, and the principal needs to take initiative for that. I always said, you're the principal, the buck stops there, and I've always felt that as a principal too. At the end of the day, those routine cleaning assignments need to be done thoroughly. One of the things that we've done is we have electrostatic sprayers, which forces an ion for bonding to occur of the chemical that would kill the coronavirus. So all of those things are part of the procedures. The reality is it's going to take all of us. And I will tell you, if you know anything about me, I'm somewhat of a neat Nick. And no matter, what hotel I go to or no matter where I go, if you ask me if it's clean enough, my answer will always be no, right? Because that's just who I am. I'm very particular. I realize that when you put in, several hundred students, it's not as neat and as clean as we would like it to do. So then it becomes, how do we maximize it to the point where it's cleaner and to the point where it's safe. And so it's really a tough deal. We have ordered I don't even know what I would call those, dividers, shields, for areas such as the media center and other areas where there's an exchange related to that. We did not order one for every teacher station. When we did the calculation, I think that came out to be 1.5 million. And other people have questioned whether or not that's really effective, whether that's an effective strategy or not.
What about the restrooms?
There's no dividers that were ordered for the restroom, no.
I would just say, from what we heard from the health department, if a face shield is not effective, then a shield between a
Divider's
desk
not.
is not going to be either.
Let me ask you this. I hate to interrupt. Do we have enough custodians?
One of the things I'm going to ask for is, and this is not an action meeting, and I realize that, but I'm going to ask for additional custodial allocations from the board.
Absolutely.
One of the challenges is, and I don't mind, kind of sharing this with the crowd, is the hiring of custodians is a challenge. And that's for a variety of reasons. It's a challenging job, and the pay is not what you can get at Amazon or other places. And I mean, I hate to say that out loud as superintendent, but it's the truth. And so
Just like
the
bus
reason why I'm asking for 7 allocations is because they would be at the district office, and then we can distribute them to the place that needs it. So one of the challenges that schools have is when a custodian is out, like they're down one person. Well, now that becomes even more critical or harder to deal with. And so one strategy would be to have those 7 people in the district office, then you can distribute them to where they're needed for that particular day so that that issue doesn't occur. So,
But as far as cleaning the district office, do we farm that out?
yeah, we have a contract
Okay.
for those folks, yeah.
Okay. So these would just
So-
be people ready to go out
Right.
to a school where it's needed.
So another thing that we've looked at is contracting out with other cleaning services on how to do that. And I know that that requires a little bit of talking to our fellow folks in CESPA about that. But I think that as a district, I wanted to try to do my due diligence in every area. So when I looked at this, I thought, okay, what if there's a major issue that we would require many additional folks? We might have to actually implement a strategy of let's bring this company in. And so we've talked with ABM and ServPro and tried to figure out, okay, if this were to happen, we might need to pivot to another form to assist our folks. We're not, doing anything in people's positions or anything like that. We're just trying to add additional manpower to make that happen. So, cleaning procedures. So now this is what we all came for, right? Right here, topics for discussion. So I realize that there's several topics that are going to require some discussion, from the board. And there's 3 of them in particular that I'd like to bring to the board's attention. And then we'll just tackle them one by one to see what everybody's thinking. So the use of face coverings and what's going to be the stance on that, the bus, transportation, arrival and dismissal, in the hallways, common bathrooms, locker rooms, classrooms, just in general, temperature checks, and then the school calendar start date. And I don't know if anybody's been watching the news, but St. John's this morning is moving to move their school year back 2 weeks. And I believe last count was 10 districts. And so districts are looking to do that. And of course, that's a discussion also. So why don't we just start with face coverings, and I'll just kind of start off and then leave it up to the board for discussion. So the use of face coverings has certainly been something that's been talked about a great deal, both in media as well as among folks within the district. And there's no doubt that the use of face coverings has been something that both teachers have recognized is something that could prevent the spread of the virus. And so when I looked at this, what I thought to myself was, and I listened to Ms. Huffman say it many times, is that when social distancing cannot be achieved, that a person should wear a mask. And then it came to my light that that the ability to do that, which of course creates the implementation, would create several challenges in the implementation. And so I offer it up to the board for their feelings relative to the use of face coverings, and go from there.
Okay, I'll take it from here.
Okay.
Thank you. You give me the good part.
Yes. Yes, ma'am.
Okay. Use of face coverings, bus, transportation, arrival and dismissal, hallways, common bathrooms, locker rooms, and classrooms. Okay, rather than calling on a board member, I'll see who wants to talk first, and we will go through to get your feelings on face coverings. And then if you need to talk about the individual places, fine. If you say, I want face coverings everywhere, that takes care of it. So, who wants to start?
I'll be happy to start.
Okay.
One of the first questions that I have is the social distancing distance. It has been discussed that 6 feet is the appropriate distance. It has also been discussed that from pediatric perspective that 3 feet can be an appropriate
they have a-
distance as
if they have-
well, with a face covering or without a face covering. My initial reaction in looking at this list is when we're talking about an appropriate distance, you cannot do an appropriate distance in a bus situation. You can, in arrival dismissal, you are in large groups. Depending on how the school sets up the arrival and dismissal procedures, there could be an appropriate distance, there may not be an appropriate distance. The difference in the discussion here is that you're talking about a variety of different arrival and dismissal procedures. You've got your buses, you've got your parent pickup, and you have your walkers and bike riders. If a student is riding their bicycle to school, I don't believe that they require a face covering when they're riding their bicycle to school. If they're walking with their family, I don't believe that it, similarly in a car. Transportation for buses, however, is a completely different situation because that is not going to be an appropriate distance. Within the hallways, the common bathrooms, and the locker rooms, here again, it depends on how the school has set up their procedures. And if in the hallway, there is a procedure, and I love the idea of putting it on the baseboard versus on the floor, because you're right, it's on the floor, we keep our floors clean, I hope, and therefore you would probably sweep it away at some point. But on the baseboards, if students know that if they're lining up for a classroom, they have to be a certain amount of distance away. That, here again though, you're all in a big enclosed area. Some people lining up in a portable might have the outside air circulating, and so it's a little bit easier. Here again, depends on the school and depends on the situation. Locker rooms, I have no idea what's going to be happening in locker rooms, and I think we have to rely a lot on what's happening in the sports situation right now and how that applies to the locker rooms. In the classrooms, this is a tough one for me because having taught 5th grade, and I'm thinking back to FSA days and having to set up my class in a situation where, fortunately, let's start with, I have desks. I had desks. Not all classrooms have desks, and now we've got that to worry about. If you're trying to put 2 people at a table versus 4 people at a table so that you have a 3-foot distance and you're able to social distance appropriately, desks are obviously a lot easier. I've talked to some principals who have desks on order because it's going to be next to impossible to set up some of the portables with round tables. That's, I mean, for what we loved the round tables for, now it's not helpful. So in looking at the classrooms, if students can social distance in a classroom, and I mentioned FSA, when we did testing, you have to set your desks up so far apart so that obviously you're going to hope that that child doesn't look at their neighbor's paper. And I wanted to say that it was, they suggested 3 feet or something to that effect. If teachers have enough time in their classrooms to begin before students arrive, to really work in their classrooms to determine what the best scenario is for that 3-foot social distancing, we're going to be able to meet the needs of many of the teachers who are contacting us saying, I can't wear a mask. We will be able to consider how we can arrange a classroom. They can consider how to arrange a classroom. And I've been thinking about their parents who are saying, I want my child to be masked at all times. Not a problem. I totally understand that. I literally was stopped, and I may have mentioned this at the last meeting, but I was literally stopped at a gas station. My name's on the side of my car. So the woman said, are you that person? And I said, yes, I am. And she said, I'm an RN. I do not want my children to be required to wear masks. And I thought, okay, you've let me know. I'm hoping, and I haven't come up with any answers, but this is something that I've been thinking about. If you can set the classroom up in such a way that those students who are not able to wear a mask, we're talking students with asthma perhaps, we're talking students with, I taught students on the spectrum. There are a lot of students who cannot have anything touching their face. I mean, there are lots of different criteria for children. And if there's some way that that can be arranged, other side from a teacher perspective, I'm wearing this mask during the entire meeting and I'm speaking, and I don't think anyone's having any difficulty hearing me. But if I were to look at someone and want to make a connection with that person, it is more difficult with a mask on. If I can set up a 6-foot parameter and literally have a piece of tape on my floor and be able to say, okay, Mrs. Bowl is going to be standing on this side of the tape. I am going to remove my mask so you can understand me. We have a 6-foot line where we have a distance, the appropriate social distance. I may then be able to remove my mask if someone does have difficulty hearing me. That's the sort of thing that each individual teacher has to decide for themselves in many respects as well. It's not something that you can come up and say, everybody's got to do this or else. The other side of that whole issue is, what's the or else? We've talked about, and we've all heard, well, we've got a dress code. It's part of our dress code. Possibly, but possibly not. What do we do with kids who don't wear the right appropriate clothes if they let
They go home.
too much skin? Not necessarily. They don't necessarily go home, because if no one's home that can come pick them up, then they go to ISS. And I'm sitting here thinking, woo, we're going to have a pretty big ISS room if kids can't wear their masks, or for whatever reason. When I first started thinking about masks and requirements, my initial reaction was, okay, I could seriously see 3rd grade and above require masks. I could see that happening. The kids are old enough to reason with, to understand. Then I started seeing younger kids with masks, and I thought, okay, we teach children, we train children how to do things, how to hold a pencil, how to properly open a new book, how to whatever. Children can learn. They learn by example. They learn by our opinion, our perceptions. If we have to wear these stupid masks, yeah, the kids are going to learn that, and if we approach it as okay, this is something we're going to do to help each other. This is where we need to, work together. It's amazing how much those younger kids buy into it as well. And so it's frustrating. I've heard from a lot of pre-K teachers, though, that are saying, wait a minute, pre-K, I don't know if they can handle this or not, because the pre-K kids need to see faces, you need to be able to talk. Here again, we're going back to the individual schools, we're going literally down to the individual classrooms. I cannot see putting masks on some of our most needy students that have disabilities of whatever form. If children are a little bit hard of hearing and they've learned how to lip read, it's important for teachers to not wear their masks. That's, here again, an individual classroom situation. Not every teacher has that sort of group of students in their class. That's all I can say for now. Turn it over to somebody else.
Ms. Bullock, we'll just go down the road.
Sure, no problem. Well, first of all, I'm going to start from the bottom and go up. School calendar.
Hey,
oh.
let's don't get to the calendar and temperature. Let's do
Oh,
masks
okay,
right
you just
now.
want to do the mask. Okay.
We're on face coverings
All
right
right,
now.
no problem. Okay, well, then I'll go to that. Well, I agree that social distancing when we can't, like on the buses, or I think we should absolutely wear them. We already determined we're only going to have a reduction of about, I think, a total of 47 students on the bus, which is about 48. Is that correct, Mr.?
No,
Two
we,
per seat.
yeah, there'll be 2 per seat. That's the bottom line at the end of
Okay,
everything.
okay, so to me, that should be, and I think we should leave a couple of seats at the front in case there's an issue or something there they have to have. And I think assigned seats is a good thing as well, so we can attract, but I think absolutely on the bus, we should have those. If there's any kind of large gathering, arrivals, dismissals, depending again on how that's set up, the school size, I mean, and all of that has impacts into that. I agree that we should, I think we need to teach personal responsibility to our students. We are so bad about, let's fix everything, let's put a rule in, a law in, or something, and not just for children, for everybody, instead of teaching personal responsibility, just like my granddaughter, who's going to be a junior at Ridgeview High School.
A junior?
Yes, I know, time flies. So anyway, her father called me and said, what should you choose? And I said, well, it's up to her. You need to talk to her. And so he did, and she came back. She wanted brick and mortar, and she's not a real social person, so I was kind of surprised. She can be left in a room. She'll do her distance learning. She got straight A's. I mean, she's one of those. My son doesn't have to worry. His wife doesn't have to worry. They just do it. But she wanted to do it. So I said, then you need to teach her that she needs to wear a mask whenever she is directed to, or whenever she feels that she's in a large group or any of those kinds of things. She needs to, if she does not feel well, she needs to tell you right at the front. You need to take her temperature. You need to do those things. You need to teach her. I mean, I want her to know personal responsibility, and I think we need to instill that in our students. I just think, and I've worked with young kids, I've worked K through 12, but young kids, I just can't even imagine all day long and what those masks are going to look at the end of the day. I mean, I imagine putting cups and Lord knows what else on those masks. And I'm
Tina,
just thinking,
I imagine them dropping on the floor and picking them back up and putting them on their face, or they've sneezed and coughed in it all day and they set it down on the cafeteria table for lunch, and
Exactly.
they've just contaminated everybody's food. So.
That's right. And, I mean, and first of all, I want to say thank you to everybody who sent us emails. I really do appreciate it. And I read them all. And the other thing I'd like to say is, I know we offered grace for everybody. Please offer grace to the school board as well, because we are on the same team. We care about each student. And like I say, I have my own grandchild school. So, I care about every student, and I want everybody to be safe. And it's difficult. I mean, we're asked to do an impossible task. And our teachers, it won't be the first time you've been asked to do an impossible task. But it happens a lot. And I appreciate all of those kinds of things. But I just think it's going to be very difficult to mandate those masks, especially when you have one person or 2 or 10 who can't, then it's put everybody there. So, I mean, I just don't think it's going to be a permanent solution. But again, that's my opinion. So, thank you.
Okay, Ms. Karakis?
Well, Mrs. Bola and Mrs. Bullock touched on a lot that we're all thinking and feeling already. First, I'd say to the 13 committees that came up with all of this, thank you. Thank you for all your hard work. And please don't take offense if I ask questions, because all of your hard work has given me more ideas. And then, well, what are we going to do about this? What are we going to do about that? So, don't take offense if I have a question about something, because I do, like everybody, we have questions, and we're not sure how the face of education is going to look from this point forward. And the picture you've painted, Mr. Broski, it's pretty clear that it's changing for all of us. So, and I'll go through the list of, the face coverings with transportation. I mean, all of it is, we're up to a great challenge here. And your recommendation was definitely on the bus. Was it in hallways and all crowded areas, or is it on the bus and then anywhere that you're not 6 feet apart?
My recommendation.
Microphone. Sorry.
My recommendation was on the bus, but then strongly encouraged in all other situations.
Okay. And I've already told everybody what I think about on the bus. I feel like we need to hire more drivers, use more buses. We need to stagger them out further. Everything costs money. I understand that. I personally don't think 7 extra custodians is nearly enough. I wish we could afford to have at least 1 extra at every school, because I really do think that the cleanliness is a number 1 priority right now. Not the number 1, but it is. It's all a number 1 priority, and we need to. Our custodians are working so hard and they're strapped as it is. So if we can find it in the budget to provide an extra at every school, I think that's what we need to look at. They're going to have to go in and do a lot of cleaning during the day, but then at the end of the night, they have to, completely sanitize everything for the next day. The arrival and dismissal, again, we heard what our director of the health department said, but I really believe we should be taking temperatures as kids enter the school. Parents, I hope, would do it before they get on the bus. And I also would like, and I'm not sure if I read this or not, as they get on the bus, are they being given hand sanitizer? That's a yes, they are. I thought I read that. So, and I'm glad to see that. And I know you said it's in every classroom and it's in the hallways. And so there's signs, and they're going to be encouraged to, wash their hands, use the hand sanitizer. For the classrooms, are we looking at a class size reduction at all? And I know we have the class size amendment and we're limited to X number of kids, and hopefully some kids will do the distance learning, some will do Clay virtual. But any of those classes that really are full to the max, are we looking at limiting it so that we really can space them out, bring in an extra teacher if necessary, and figure out how to reduce the number of kids in every classroom?
Yes, as you can see, there's already 4,000, folks choosing a different option.
Yeah.
So in theory, it would reduce the number in the classroom. And of course, we'll work to maximize that to the greatest extent possible.
Okay, very good. Are we looking at, so speaking with some people from around the state, classrooms using the cafeteria for lunch? We have to have a, contact tracing on the students if somebody should come down with it. And some of the districts are not using their cafeterias. They are having the students eat lunch in their classroom and having a teacher's aide, a monitor, somebody come in and relieve the teacher for their 30 minutes. Have we looked at that at all to keep those students, not say isolated, but keep them away from the large gathering areas, have lunch every day in the classroom instead of in the cafeteria? And then the cafeteria could actually be broken up and used for, if you have classes that have to be spread out, or we don't have enough portables or classrooms or whatever, maybe something like that. I've heard that from other districts, that that's something they're looking at.
So we looked at all possibilities, including students, eating in the classroom. And one of the things that I would say about that is that I can just tell you, as a high school principal, I would tell teachers to not let students eat in the classroom, that everybody had to go down there. There are teachers that like for their students to come back, but it'd be voluntary. But anybody out of the main area is one less person in there to help with that situation. But the primary focus was to have other areas to eat lunch, not just the cafeteria, thus creating more social distance.
No, what I'm saying is, don't use our cafeteria. Everybody stays in their classroom, and lunch, hire additional cafeteria workers and bring lunch to the classroom so that the kids remain there. So the kids stay in their classroom for lunch.
He said he recommended they not eat in the classroom.
Mrs. Studdard, I'd like the superintendent to explain to me why we're not looking at something like that. He
So
didn't say
I
that to
think
me.
that one of the things would be that teachers would have to either agree to that, or we would have to hire additional folks in order to make that happen, would be how that plan would potentially work. When the task force was together, we looked at all options. And of course, the additional personnel would be a challenge to get all of those additional personnel needed in order to pull off such a plan.
So what are we looking at with the bus schedule as far as the start time for like junior high, elementary? Are we going to have to push those times back at all? with, less kids on each bus? Are we going to have to add more routes? Or are we having an issue with anything like that you've
So
looked at?
currently, we're going to hire 25 additional bus drivers. They're already in the training, so we feel like that's going to happen. We're going to add those routes to lessen the number of students that are on the bus. But no matter how you slice it, just like every other district, buses are going to still have 2 students in a seat. When we looked at how to make the original recommendations, which I believe were 13 on a bus, happen, the cost to do that was roughly $44 million in order to make that particular scenario happen. So it becomes an issue of trying to lessen the number of people on the bus to the greatest extent possible. And I know that Mr. Sweat and his group do a great job of doing that. Also surveying parents to see how many are actually going to ride the bus. Parents may choose to not ride the bus. And you won't know that until the surveys are in. So you won't know the actual number per seat until that occurs.
One other question I had, someone stopped me in the supermarket. They wanted to know, will we be continuing all of our after-school activities, sports clubs, math team, all of that?
So it's my understanding that FHSAA meets on the 20th, I believe, is their next meeting. Right now, we don't have clarity on that issue. A lot of theories have been thrown out, such as, which I thought were kind of interesting, were switching fall and spring sports, right? Because football is a contact sport, baseball, and other sports that are traditionally in the spring. So all of that was thrown out there. There's been no decision on it, but I know people are working on that. As soon as I know, I'll be glad to announce. I will commend coaches that are out there right now. I saw Fleming Island's weightlifting. I don't know if you saw that. They were outside. They moved all the weights outside, spread out 6-8 feet. Actually, they look like they were 10 feet apart, trying to lift weights because the weight room itself is a more confined space. So I will say this, we have a lot of creative people that are hardworking that find a way to get the job done. And so athletics and all of that is a wait and see at this point.
Right, but what about the clubs? I mean, we'll still continue, not just sports and athletics, but yearbook, all of the robotics, all the other things that our kids do.
Yearbook is typically a class in addition to that.
Right.
So we don't plan on cutting those things, provided that we can put a safe environment of social distancing for students. And that's really the criteria. I will tell you that there is no doubt that there are more questions related to the opening of schools than anyone could possibly answer. That's true. Right? And so there'll be many things that'll come up even after this meeting that will all say, hey, what about this? What about that? And so we'll do the very best we can. I've always focused on taking the information that's given, analyzing it, and coming up with the best plan with the facts that are given at that time. And that's what I'm going to continue to do.
Can
I have
May
another
I
question.
May I ask the board this? We're supposed to be talking about face coverings right now, and we are going to have a lot of questions, and then the board will have a lot of time to discuss, and we can throw out all these other things. But right now, let's get back on topic to the face coverings.
All right. Mr. Broski, I'm trying to think, what was her name? Heather Huffman, Director of the Health Department. Did she issue us any kind of letter or statement in approving our plan with masks for transportation, for cafeteria? Has she issued anything in writing saying that's her recommendation?
Nothing in writing, but you heard her recommendation here today, and she is a member of the task force, including Mr. Ward.
All right, thank you. Those are my questions about those items.
Okay, thank you. Ms. Gilhousen.
I really don't feel like I have much to add. I feel like you guys have, no. I'm glad that we're all kind of in unity here, thinking in the same direction. This face mask issue has been so divisive, and it's, I think at the end of the day, like you said, we've got to go back to personal responsibility and truly professional judgment. I think our teachers, our principals are the ones who are going to have to implement these measures. And so to give them as much support in doing that as we can, I think is probably the best we can do as a leadership team. And like I said, I have some real fears about some of our younger students. And, you know, it's one of those cut off your nose to spite your face things that you've maybe protected.
But you won't be able to see it.
But, you know, I'm thinking the potential risk of picking up germs in the bathroom if they're messing with their mask while they're in there. And yeah. So anyway, all that to say, I think, again, it goes back to personal responsibility and professional judgment.
And here again, going back to the schools, and with the common bathrooms, I'm just off the top of my head, it was if you're there for a greater period of time. Now granted, people are going to breathe on each other. I
Right.
mean, kids are kids are kids. As a female teacher, I cannot go into the boys' bathroom
Right.
and monitor it. We don't have enough male teachers to be able to do that. And so if someone, you know, I'm almost tempted to say, hallways, yes, locker rooms, depending, arrival, dismissal, yes, bus transportation. Common bathrooms, when you said, oh, they'll drop it on the floor,
Yeah.
immediately I thought, nope, I don't want them
Well,
wearing
because
a
here's the-
mask. And they're
here's the
only
thing,
in there for a moment or two.
Right. And if they take it off, where do they put it?
And
So
Or if they don't wash their hands.
well, and I can tell you as a
they're in there, their mask
no,
is
but
on.
if they've worn it, okay, let's say they've worn it through the hallway to the bathroom, and then they come back to the class and they take it off, then all the germs from the mask are going to be on whatever they set the mask on. So there's a lot of scenarios to think about, and I think we have to, as professionals and individual classrooms and individual settings, figure out when the benefit outweighs the risk and when the risk outweighs the benefit. And I trust our teachers to be able to train students, like you've said, to use personal responsibility and good judgment.
I have one more question before we move on about the mask. Mr. Brodsky, how do you, or what do you see happening as far as the teachers being able to enforce it? Will the teacher have the authority in her classroom to, you know, mandate that they all wear a mask?
So, you know, the purpose of bringing the item up was for the board to come up with whether or not they wanted a policy related to it, because enforcement, if there's no enforcement piece of it, then it's just a suggestion. It's not really a policy. I would say this, you know, most teachers can find a way to teach personal responsibility if that's the direction that goes, but it's more difficult to do that without a clear policy related to the issue. You know, would there be issues with implementation? I do believe that there would be issues. I think there's issues when we have dress code related to anything. Any sort of dress code issue creates challenges. I do think that that teachers would do what they always do, which is find a way to get it done relative to that.
Okay, I guess I'm the last one. As y'all have said, this has been the hardest decision that we have wrestled with. This, you know, redistricting doesn't hold a candle to this. Because we are dealing with people's lives. And this is this life or death situation. I'm not a teacher. So, Ms. Bola, I understand what you're saying and I get it. But we're all parents up here, and these teachers, most of them are parents. And we have received, I haven't even counted, there's so many emails, and we've been chastised for not answering all of them. There's not enough hours in the day to answer all those emails. I have read every single one of them, though, and really thought about it, and I'm sure y'all have too. You're talking about teaching personal responsibility. I understand that. That's good and worthy. But I have to look at these people out here. I think primarily these are teachers in the red. I'm just going to have to tell you how I feel. I think everybody should have a mask on. I do. No, we don't do that, please. You can do this. But I don't want to take away, I mean, we have had some few emails that said, I'm not going to wear a mask, and I just refuse to wear a mask, and so forth. And I do realize there's exceptions to saying, and I'm only one of 5, but I want everyone to wear a mask. I want them to wear it on the bus. I want to wear it, I don't care if they're 3 blocks away riding their bike to school, but when they get off of that bike to come into school, I want them to have a mask on. I want them to have a mask on when they're going to get in their parents' car. I want them to have a mask on if they're going to go get on a bus. I want them to have a mask on when they're in the hallway. I want them to wear a mask to the bathroom. I want them to wear a mask in the locker room. I want them to wear a mask in the classroom because I want to save their lives, and I want to save the life of our teachers. I cannot stand the thoughts that one child or one teacher would come down with COVID because I didn't want to be too cruel and make people wear a mask. Well, sometimes we have to do things we don't want to do. As y'all can tell, I don't like wearing these things. But they make my glasses fog up. But we've got to figure out a way to keep everyone alive. This is serious business, and if you've read the paper and seen the news, read the newspaper and seen the TV, the numbers are going up, up, up. And I know there's going to be some people that mad, boy, she just doesn't know what it's like. I get it. You've got a right to feel that way, but your life and your child's life is more important to me than you getting mad at me because I said you need to wear a mask. Listen to the Heather Huffman. I mean, we are recommending to wear a mask. Now, there are exceptions. I think we had some emails from teachers that had, asthma or very serious things. We have to make exceptions. There are children who absolutely cannot wear a mask. Okay, let's look at this on an individual basis. When there is a legitimate reason, I'm not going to tell you that you have to wear a mask, but I don't want a child sitting in a classroom and there's no mask, or if half wear mask and half don't, it makes no sense. Let's make a rule. I was in the grocery store Sunday afternoon, and there was a little girl about 3 and one about 5 with her mom and dad in the grocery store, and this little girl wasn't up to my hip. She had a mask on, and they were being very careful about it. I think we can teach our children to do this because it's for their own good. Sometimes we have to be a little stern, and I do want to make exceptions for teachers that have asthma or problems. We can work around that on an individual case, just like we can on a child. If you've got a child that's special needs and they can't have things around their face, that's the exceptions I'm talking about. But I think that's where the principal and the teachers can get together and figure out a way to make this exception work. Now, that's just my feelings about it. I am so afraid of losing one of our children. I had a former employee call me Saturday, and she said to me, my grown daughter and my grandchildren have just tested positive. I don't want to hear any more cases like that. My own granddaughter tested positive at the University of Florida, and she's fine. But I went to get tested. I got my husband tested because, I've been around my daughter who had been around her daughter, and, this is scary. We can't play with this anymore. We've got to knuckle up and face the consequences, and it's going to be tough to teach, especially the little people. But the little people see the big people doing it, and they want to do it too. They want to be like big sister or big brother. So, the majority of this board can decide if they want to make it strongly recommended, but strongly recommended to me has no teeth in it. I just say, let's say it, and that's all I've got to say.
Well, I'll go from here if you're ready to move on.
Yeah.
Um,
Well,
I
mean,
really think that
let's
we
wrap
should,
it up.
we should postpone the start of the school year, Mr.
Well,
Brodsky.
we
I
haven't
think
gotten
that's
to
something we
that.
should look
The
at.
school calendar is coming up in 2 items.
Mr. Brodsky.
Thank you.
So if I could, a little bit more direction when it comes to the issue of face covering. So what I heard was from 4 board members that they wanted to keep the current language, which is strongly encourage.
Hang on. You hear us say strongly encourage. All of us have looked at this and said, yes, we like face coverings. We want face coverings. We want to strongly encourage face coverings. The problem is that none of us have brought up the idea of an actual policy per se, and that there are going to be a lot of, for want of a better word, what ifs within
Right.
that
That's
policy.
right.
And if, depending on how we can word it, I'm going back to the notion that the schools individually are going to have a better opportunity of understanding what is going to work within their schools. I mean, I'm not going to jump back to the cafeteria topic yet, but that's a whole nother, that's part of that.
Yes, ma'am, I understand that, but you can't have a policy that only applies to certain schools.
Correct.
And leaves it up to the school to make a decision.
Yeah.
So
Let me,
that-
So-
let me
so
butt
when
in here just a minute.
Yes, ma'am.
If this board decided that they wanted to put something into place, Mr. Bickner, what would be the manner to do it in a way that we, I don't know if they'll go along with mandatory face masks, but whatever the majority of the board wants to do, what is the best mechanism for getting it into our procedures, policy, what?
Am I on?
Yes.
I can't tell. At this point, I think that the best way to put it into policy would be to make it part of this reopening plan. And the reason for that is because once the reopening plan is adopted, as I've explained to several board members and also the superintendent, you're going to have to do this as an emergency adoption. Because in my opinion, and in the opinion of all of the lawyers that I've talked to across the state, this is policy. When you create this, you're doing rulemaking, and in order to do that, you have to have a certain period of time for advertisement, a certain period of time for publication, and you have to have public hearings. None of that is available to us right now because we got a notice on the 6th and have to respond by the 30th. And so I think we can put it into, if you choose to, you can put it into the reopening plan, and then that gives us a period of time, and it becomes policy when it's adopted on an emergency basis. It exists, it's there, and it's real. After that, it's only good for 90 days, and you have 90 days to go through all of the hoops and all of the niceties and all the requirements of the Administrative Procedures Act to make it firm and final. And so you end up with a policy that's good for 90 days on an emergency basis, and then you go through and you do everything necessary to make it permanent. In that time period, one of the problems with this whole process is that the only constancy in this whole process is change. And so during that process, as Mr. Brodsky and I were speaking about it the other day, it might be better once you've got it in place to have some time period lagging in there anyway, because you're going to have to figure out how to do things that are in a constant state of flux. And it may be that you're going to need to change some of the ideas that he has and some of the ideas that you adopt and that you look at, simply because when you start looking at how it's going to pan out in individual schools, it's going to be more difficult to implement than you thought. And so in that process, during that time period, we can create whatever's necessary if you're going to put it in the code of conduct, if you're going to put it in the dress code, or if you're just going to leave it in the reopening policy that's been finally adopted. And so that is the way that I would proceed with it.
So that would buy us some time to tweak.
One of the
It seems
things-
to me like,
Go ahead,
talking,
I'm sorry.
with talking with Mr. Bickner, the dress code is where it should go, not an actual policy, but in the dress code, because, that's that's what they would be wearing. It would be part of their, but again, enforcing that is going to be a challenge.
That's why I feel like it should stay in the reopening plan.
It would go in his reopening plan.
Yeah.
Because if you move it to the dress code,
Then it has to go somewhere.
God forbid we're in this situation permanently.
Yeah.
You wouldn't write a policy on it, because a policy is really something for the long-term well-being
Yeah.
of the district for years to come. You write
Right.
policies for future
I
boards
would-
down
Right.
the road.
I
So
would
it
be
wouldn't
more
a
comfortable
policy.
I agree.
with it in the
shouldn't be a
reopening
policy.
plan.
I think it just
that's-
needs to
that's
stay in the
best
reopening
way.
plan, 'cause
So
it's
we have a
specific to this
consensus on
situation.
that.
And then it has an
Now-
expiration.
Right.
But what Mr. Brodsky needs to know
It's
is,
the wording.
do
I
you
say strongly recommended and encouraged. That's my
strongly
comfort.
recommended? And what about you, Ms. Karakis?
I'd like to know what Mr. Brodsky's recommendation is. What is your recommendation?
My
Do you-
recommendation
Do you want
is-
mandatory masks, or do you want
Well,
recommended?
that's up to the board to decide. My recommendation is that students wear masks when they can socially distance.
And I think we could leave it phrased like that in the reopening plan.
May I add,
So
may I add
repeat-
one thing as
repeat.
a thought?
Excuse me?
As your attorney, may I add one thing to think about? From a risk management legal perspective, one of the first signs you've got sitting out here is somebody that has a definition of negligence is a lack of reasonable care. In the event that there are lawsuits in the future, I can tell you, having done medical malpractice litigation for 25 years, standard of care is everything. This is not a strict liability situation. You can only do what you can do. And if somebody chooses to file a lawsuit against you, they have to prove negligence. We are not guarantors of anybody's safety. Okay, that's the reality of it. The world is a dangerous place. But we are responsible for doing what can be done to prevent an incident. And that's reasonable care. And so as long as you have met the standard of care, as long as you've done what the CDC recommends, and mostly what our own health department has given you the tools to think about and to recommend, and those other things that are necessary, social distancing and washing your hands and wearing a face mask, as long as you do those things, you are not negligent. You have met the standard of care, the reasonable care necessary to defend you. It's when you don't do those things and they're available that you end up having a problem with a negligence lawsuit. And that's all I want to say about it, but that's one of the things that you need to think about is, how does this play out? Most of you were not here. Ten years ago when we had a child die on the playground in its first week of school at kindergarten. It was extremely traumatic. And nobody will understand that. And that's where you have to say, we've done everything we can do. And that's the defense.
Okay, if the health department, they recommended we wear masks, right?
She didn't say that. She said the tools were an effective thing to do, and the tools were, it's one of the tools in the toolbox. And so I didn't
Okay.
ever hear her say, I
Well,
recommend this or I
All right, here's my
recommend that.
question. Would highly recommend, or whatever Mr. Brodsky's words were, strongly recommend wearing masks, is that defensible that we have done all that we can do?
No,
No?
no.
Okay.
All you can do is to require it. And everybody said, and I understand what you're saying when somebody says, well, how do you enforce that? I was talking to a principal, or I was talking to another attorney who was talking to his superintendent, and the superintendent said, that's not my problem. That's a principal's problem. Principals know how to enforce the rules in their school, and they know how to get their teachers to enforce the rules in their school. And so if it is something that's required, they know how to implement what's necessary to make that requirement stick. Now, I don't know that. I'm not an educator. I'm just a lawyer. But that's what the thinking was in that particular instance. When you're asking me as a lawyer what I think, I am your legal counsel, and I think risk management is extremely important, and the way to do that is to do what's reasonable care, standard of care.
May I ask a question?
Sure.
Is there a difference between must wear and mandate that students wear, or that any employee wears a mask. Is there a way that we can word this so that it gives us the the background that we need, the backbone that we need to, would it be to mandate the usage of masks?
In my opinion, yes. It would say that, the wearing of face coverings, parentheses, masks, whatever else you want to call the different things, is required in all circumstances where you're inside of a building and are outside of a building and unable to socially distance, and whatever other guidelines we would look at. That's all wording of creating what goes into the reopening plan. I've told you before, I'm a master of words. They are my craft. I can do what needs to be done, but you have to decide, are we going to recommend it? Or are we going to say, this is what you will do? End of story. Because you can say that and still make arrangements for people who are on the spectrum, and people who have difficulties, and teachers or adults that have other difficulties. We're not worried about the custodian. The custodian needs to wash his hands mostly. He's not going to be there most of the time in the presence of children that are doing things or other people. And he knows how to take care of himself, and he will be provided those tools. What you're worried about is people in the heat of the day, in the hubbub of the day, in the midst of all of that school stuff. That's where the problem is. And that's where the mandate must be.
Could we say mandatory or mandated, except where social distancing is possible?
I can craft language that does what you're trying to
Now,
do.
would that keep us out of legal trouble as far as being charged with being negligent?
Isn't that already what Mr. Broski's saying, though? Isn't Mr. Broski saying it's
That's what he's
required
saying.
unless we cannot?
He
But
said
he's
socially
not-
distance?
so he's saying strongly recommended. We would be saying it's mandatory except where they can socially distance. And would we be protected if we did something like that, Mr.
What is
Chairman?
reasonable care? It's not reasonable to require it when you get on your bicycle and drive off the school ground. It's not reasonable if you're running outside in an open playground and there's 10 children on something the size of a football field. You see what I'm saying? So yes, I can craft things that say that describe what is mandated and what is not mandated and still meet all of those requirements.
And we would be protected legally, you think, with that?
Well, yes, you would be using reasonable care and you would not be negligent. Can somebody still file a lawsuit? Of course.
Well,
Is it beatable? Of course. That's just the way.
now let me ask you, board members, would y'all be able to go along with that language, with the mandated with social, unless they're social, they can have social, could y'all live with that?
Well, let me ask a question. Say, for example, a classroom, and I'm just thinking like an elementary classroom, and they have, say, 18 kids, like in a kindergarten classroom, and they're able to move their desk within is it 3 feet? Because the pediatric says 3 feet, and we're able to do that. They wouldn't necessarily have to wear the mask then if they are able to do that. Is that what we're saying?
I think that when they can socially distance, I believe, would
think
So
be.
if they're able to, and not
Yeah.
that they'd be able to, but like some classrooms might be able to.
Right.
And so then they
It
would
depends
be,
on the classroom. Oh, and I have a brainstorm. Y'all may poo-poo this. Mr. Broski didn't seem real excited, but you were talking about the little kids. They pick their nose, they wipe it on the mask, they put it in the food, they drop it on the floor. I mean, y'all saw the Facebook post where all the different wonderful things that can happen with little Johnny and his mask. I saw something the other night, and it was someone who had the mask, but they had a lanyard, like,
saw
people's
that.
ID tag on. And when little Johnny took his mask off, or it fell off, or whatever, it's attached to his lanyard, and it doesn't hit the floor, and hopefully wouldn't hit his spaghetti at lunch or whatever. But I said to Mr. Broski, that for the younger students especially might be a good idea, because at least we wouldn't have it hitting the floor and then putting it back on their face. But I don't know what they cost, and maybe we would want it just for the younger grades, but I thought that was a neat idea. I wish I had that right now, so I could pull it off and not have to keep reaching for it. But I kind of thought that was a neat
Now, who
idea.
would provide the mask, I guess is my question. I mean, are we gonna have a standardized mask, or that's my question?
Yeah.
If
I
that's
think
the-
in trying to implement this, we'd ask parents to provide face coverings. If they didn't have it, then we would provide them. With the logic being that parents know best which one would fit their child
Right.
the best, rather than us
But we
guessing.
will have them at school for those who don't have them.
Yes, ma'am, we'd have to do that.
Do they come in different sizes, like for little people?
They do come in different
Okay.
sizes.
I kind of feel like before we really tackle whether we write a policy or put this into our reopening plan, I feel like we should discuss the start date of the school year. I don't know if
Okay.
anybody else
Well,
feels the way
you
I
want
do.
to leave that
but-
in a, well, I just wanted to get this part, the mask part put to
But
bed.
before we give a definite, yes, I want a mandate a policy or not, let's decide, are we all in favor of going back August 11th or
Okay.
postponing? Because
All right.
I, for one, definitely think we need to postpone as long as possible. I mean, if we have to go
I'm in
back by the
agreement.
end of August, and I'm not sure, Mr. Bickner, we had kind of talked about it. Is there a set date that we
I think
are
August
required to
25th
go
would give
back
us the
by?
5 days.
Because I would love to see us go back sometime after Labor Day and see what happens with,
I thought we
you know,
had to
this
start in
whole
August.
curve that we're in right now.
Okay. Let's jump then to the school calendar. Mr. Brodsky, I'll let you lead that, and then we're going to come back to the math.
So there's been about 10 districts so far that have delayed their start date relative to when to start school. I think there's a variety of thoughts that are out there related to that. One superintendent I was talking to was talking about additional training for teachers and finding the opportunity to do that. Another one had talked about the fact that, just like in our district, they're opening up several new schools, essentially, and the movement of staff to ensure that it's properly staffed and that we provide the best customer service possible to our parents was another idea that was thrown out there relative to school calendar. Of course, in our situation, we have a school calendar committee. It's negotiated with our employees as to how that works, and then it's the purview of the board at that point. So, that's about all I have to say about it.
Did you say that the St. Johns County has delayed theirs a couple weeks?
Well, this morning at their board meeting, not that I'm spying, but I did watch intently. Sorry, Tim. I did watch
How are
intently.
you going to learn?
It's not finalized, because just like we would have to, if the board decided to move the date back, there's some stuff that needs to occur to make that happen, to bring it back to the board for a formal vote. And that's kind of where they ended up.
What
So it's-
date did they look at?
they looked at the 24th or 25th.
See, that would put 5 days into August. If that's what
Yeah.
that's my understanding for the executive order. We had to start in August, but in 5 days, the brick and mortar would put, if we started on the 25th, that's a Tuesday, and then that would go through the 31st, which would be the 5 days in August.
Wait,
I don't think we have
No.
to start in August, though, do we, Mr.
Yeah.
Bickner?
I think we do.
okay, because Monday is the 31st.
Yeah,
Okay,
so we'd be good if we,
I know-
but I thought the executive order said we had to start in August.
What the executive order does is makes an assumption. In paragraph 1, under reopening requirements, it says, upon reopening in August, all school boards must, and then it gives you the things to do. And so it makes that assumption of opening in August. It doesn't specifically say that you have to open in August. The problem that I've seen, and I've talked to every school board that I can, or attorney that I can find to talk to, the attorney for FADS, the Superintendent's Association, has recommended strongly that no one proceed past the 24th of August to open.
Okay.
And I was unable to get an answer as to what her exact thinking was before we came down here today. Every other school district that I've talked to that's thinking about changing, Alachua was looking at the 24th, Lee County's looking at the 24th, Brevard is looking at the 24th. They've experimented and thought about going as far as the 31st, and all of them have backed down and given it that extra week. I've found no one who is willing to go past the end of August. There are 3 school districts that are still in phase 1 that may never open a brick and mortar, and that's Palm Beach, Broward, and Miami-Dade.
Right.
And they're looking at just opening purely with distance learning. Now, what the effect of that'll be, I don't know. But they're still not talking about opening in September. They're talking about opening distance learning by the 24th of August. So I don't know of anyone that says go into September.
There was something in today's newspaper that Duval County Superintendent, Ms. Green, was looking at filing a waiver to open later. Would we have to file a waiver for the 24th, or was she looking at something past August?
I don't know anything
That would
about
be
that.
for later.
So my understanding of that situation is that the answer to the question is no. I don't believe you need to file a waiver in
Okay,
order to go
thank
to the
you.
24th. But they are looking at, for a variety of reasons, looking for an exception to when to start and whether or not they want to start in a certain format. And so I'm not sure what's been publicized. I'm trying to be coy about what I
Yeah.
know
She's-
relative to it.
It wasn't anything real definite in that newspaper
Yeah.
article. I personally don't have any problem, even though I know the calendar committee will have to meet again, Ms. Dennis. But I would say if the board wants to delay the starting of school, I'd rather go on with the 24th, because I know with the calendar committee, as it is, we're gonna have to seriously look at it, or our kids will be going to school half the summer. And, so we'll have to look at what we could do on the calendar committee, but, I would like your, input on, do you have any objections to postponing the start of school from the 11th to the 24th?
I don't have any
would be
objection.
fine
I
with the
don't, and I just
24th.
think that
What
way,
about you, Ms.
it gives
Miller?
us a little more time to
Yeah.
buys a little more time, and
Yeah.
the other thing is that we can look at other districts,
Right.
and if they've run into issues or what's working, what's not
Right.
working.
Right.
I think you have a consensus that we are willing to go to the 24th to start school. This will give the superintendent and the principals and the teachers and support everybody time to plan.
Right.
I think that's to our benefit. And as y'all know from TV and newspaper every day, I mean, we're planning towards a moving target. This thing is just, we're doing the best we can. What was it, someone said this was like flying an airplane, making plans, what was it about the airplane?
Building the airplane while you're flying it.
Yeah.
What I think what we should look at, and you're on the calendar committee, but it would make sense to just extend the year 2 weeks and not take away anybody's Christmas break or Thanksgiving.
Yeah.
Keep the holiday times
Yeah.
that people have come used to, they're
Right.
accustomed to a week at Thanksgiving,
Yeah.
2 weeks at Christmas, so maybe just extend
But
to,
we
a
may,
little longer.
depending on what we are required to do.
Right,
Because
Yeah.
we've also got some flexibility with that 180 days.
right.
And the other side of it, I'm looking at Dr. Legutko, and I think one of the biggest concerns that teachers are going to say is, are we still going to get paid? And we're dealing with dates, which is fine, but you
Right.
have to look at pay. I'm
How would we-
concerned, I don't know how much has been ordered or where we're at right now, for instance, with food services, if we've already started ordering things for August. Great, thank you.
What did
I
she-
was- I
what
was
did
just-
she say?
said
She
no.
said we're good.
I cannot see her.
Got it, thank you. I mean, I'm thinking about what sort
Right.
of impact would that have on all of the other areas of the schools?
You're right.
Not only the teachers, but then the bus drivers.
Mm-hmm.
We've got custodians that are coming in still, so that would give us a little bit of additional opportunity. The other side of this, and this is talking to some teacher friends who have said, if we start in August and we only have that 1 week to plan, we want to be able to get our classrooms in order, we want to be able to get everything in order, but we also need to learn what the procedures are going to be.
Right.
And in calling a couple of the principals and saying, what do you think about this? and hearing, boy, it would be nice, instead of using a stick figure, to plan which direction are the rows going to go? Which direction are people going to be walking? Going up the stairs or down the stairs? What are we going to be doing?
Give them more.
Using the teachers' literally warm bodies to be able to say, okay, what does it look like to be 3 feet apart? What does it look like to be 6 feet apart? What does it look like in the cafeteria when we are going in to get food, coming out with our food? What does it look like going to resource? How do the resource teachers, how are they going to be able to do it? But if we can use some of that, maybe extend the pre-planning time, and here again, I don't know how that would be affected in contracts, et cetera. That's an MOU perhaps or whatever.
Yeah.
But getting more of that planning together ideally would take some of the anxiety away from the teachers, because we're hearing from teachers who are incredibly anxious. I spent 2 weeks with my daughter, who is a high school teacher, and just discussing, how am I going to clean the computers between classes? You know, I mean, simple things that you have to sanitize. And hearing that anxiety and just trying to assure, you can't. I mean, we have no assurance right now.
Right. And we've
Let
got
me-
several
We can't
emails
say
about
to
the
them
the
and
teacher
say,
planning also.
Everything will be fine.
Let me
Yeah.
ask Dr. Legutko
Right.
something. Dr. Legutko, as far as the teacher pay, now, if they were going back on the 3rd, then are we, I want to make, I guess what I'm asking you is, I don't want to hurt the teachers and their pay. Can you do this so that they still will get their paydays? What'd she say?
Who is speaking?
We don't do that. What'd she say?
That everybody still goes back on the 4th, but the kids don't show up until the 25th.
So
Okay.
the calendar committee would have to work out the dates as to when teachers would return, as well as the start date being the 24th, is what I'm hearing from the board.
Okay,
So the
okay.
question, Dr. Legutko, is, will the teachers get paid?
Can you hear me? Yes. Okay. Again, it depends on the calendar committee, depends on when they do get back, return. I know at the original, yes, they would have gotten paid, depending on, the return the week before. I believe that, again, depending on that date, we could work on a time frame that they will earn the same pay that they would have if they were returning on the
Well,
11th.
and this is something, I
the
guess, that with the calendar committee and Mr. Broski's input, do they need to come back on the 3rd, or when can they come back and still, this will give them more time for planning and so forth, and we want to be able to do that, but we'll just need to find some kind of, I just want to make sure that we don't mess up their paydays.
And again, it's dependent on the calendar committee. I'm going to wait on and see what that turns out to be. I believe, because of today's discussion, that committee will be meeting
Very soon.
promptly to determine what the dates are going to be at that point.
Okay.
Dr. Legutko, when's the next payday technically for teachers if we were to go back to school normally?
August 31st,
So the end of August is the next pay period.
right,
Got it.
for teachers.
Yes, yes.
Yes.
Okay, but y'all will figure out
Yes.
before we meet.
Correct.
I have a question. Mrs. Bola, twice now you've referenced the 3 feet American Pediatric distancing for elementary school. Is that the guideline you're going to use, Mr. Broski, for elementary school?
So the guideline is 6 feet. She's referring to a research article from the American Pediatric Society. One of the things
It said with a mask 3 feet was.
I know that. I'm
So I-
wondering what our school will be using, because Ms. Bola
So-
referred to it twice, but you
So it's
didn't.
the 6 feet is the goal that we're using. That is the recommendation of the Health Department of Clay County. One of the challenges with this situation is, depending on what source you go to, you get a different bit of information. And so she was a member of our task force and a trusted member of the community. So we're going with her recommendation, which is 6 feet.
Right, so if the children are less than 6 feet, they will have a mask, and that'll be the guidelines that all teachers will, everybody will follow.
So the discussion was up to the board, and we gotten to the point where 2 board members have said that they're willing to go to the mandate portion of that. And then we're still waiting on further direction from other board members.
Yeah,
Well, no, what I'm asking is what was your recommendation in your plan, though? It was the 6 feet and not the 3 feet,
Yes,
correct?
ma'am, it was 6 feet
That's what I was asking.
for social
All
distancing.
right, thank you.
now let's get back to what we were talking about before. Mr. Bickner explained for us, a way for us to be protected legally. Ms. Bola has indicated that she would go along with the mandate with the exception. He said he can do the language.
With the exceptions.
Right. Would anyone else like to do that? Because that's way he said we will be protected.
And so tell me what the exceptions would be again that we're discussing there.
Mr. Bickner?
I can't give you a detailed list of what the exceptions are
Okay,
as I sit
but
here
I mean,
today.
kind
because
of
I
a
would have
general
to-
thing.
But like
Okay.
asthma and.
I would have to have a discussion with social workers, I'd have to have a discussion with some
So,
people.
so
in
if they have a
guidance.
medical issue
Right.
Yeah.
or
Yes.
language impaired, I'm thinking
Right.
students who need to see, okay.
Yes.
I mean, we've got to be flexible with the
I-
exceptions.
I can make it very flexible and also very inclusive with exceptions.
Can you live with
Because
that?
we want to protect our staff people, but we also want to
Right.
be able to have our students be able to be protected as well.
Absolutely.
Absolutely. So would you be all right with that, Ms. Bullock? I mean, Ms. Bullock?
Yes.
Okay. Ms. Carrickus?
Absolutely.
Okay, Ms. Okay, but
I'm not comfortable mandating it. I
okay.
would prefer to
Four
keep
of
the
the
current
board
language.
members have said that they can go along with this.
But with the exceptions.
With
And
the
that's
exceptions.
the
Yeah,
key,
absolutely.
because
You've got to
there
have
are
some
going to be
flexibility.
exceptions with teachers who may not feel comfortable wearing masks the entire day too. And that's, I don't know if you can build something into it with working with the principal. That's what I was getting
Yeah.
to before.
Yes,
And
I can.
I'd like to see this extended to the district office. I would think if we're setting it for schools, we're going to have it mandatory at the
Right.
district office for
Absolutely.
anybody who enters to
So,
wear.
Oh,
so
absolutely.
just for clarification, we're saying that in times where social distancing can occur.
It is
that-
mandatory.
Okay.
That's correct.
Right.
Because if social distancing can occur, then you can take the
And-
mask off.
And a
If you
perfect
can social
example,
distance, you can take it off.
a perfect example is if a teacher is 6 feet away from the front row of their children, they can take their mask off so they can teach. Does that make sense?
Yeah.
Okay, I mean, that's the sort of thing I'm thinking of, because there were a lot of teachers who reached out and said, you know, I understand that the union is suggesting that we do masks, but I don't feel comfortable doing that. And that's, I understand that, I totally get that. And in a public situation where you're going to the cafeteria, or you're going on, you know, rival dismissal, duties, you know, different duty stations, things of that nature, I can understand mask mandate.
Absolutely.
However, if a teacher is, I mean, frankly, I've been sitting here in this mask, we all have, for the last 2 hours, 2.5 hours, and I don't know of anybody who's probably really comfortable right now with this mask on their face. But if I were talking nonstop, this would be soaked. And to me, that's not healthy for me either. And in a situation where I'm working with students, and if they're 6 feet away from me, I could take this mask off and feel comfortable that I am social distancing. And that's the concern that I have with a mandate.
Yeah,
I don't like mandating anything.
yeah.
I
Well,
don't
and
think
I
that's
do
what we
hope that you can work it out somehow, that we can have like mask breaks. I mean, if it takes
Well, going outside.
taking the kids outside to walk around 6 feet apart, but just to give us a mask break. You know, it feels good. I don't know how you can do that in the schools, but the teachers and the kids will need a mask break occasionally.
Mr. Bickner, can you repeat the language to me of how it's going to be worded in this reopening plan?
No, I can't, because I haven't, it's
I've
gonna
heard
be a
it so many
drafting
different
report.
ways now. I'm
What I
not
was
sure what we're
gonna-
all agreeing to. I want to make sure everybody's aware of what we're agreeing to.
What I was gonna say, it would be utilizing a mask, mandating utilizing a mask. Whenever you're in a situation where social distancing cannot be utilized.
Thank you.
And that would include, but not be limited to, class changes, being in the hallways, being in locker rooms, being in restrooms, being in classrooms if necessary. But I can't give you the language you're going to use because I don't work quite that quickly. But what I will promise you, and
I know that brain is working.
it's working, it's chugging away right now. But what I will promise you is that after speaking with Mr. Broski and working with him tomorrow, I will provide you a draft of what I do by Tuesday of next week.
Okay.
It's
I
going to
have
be,
one concern when we're talking about exceptions. Is that going to require a doctor's note for a teacher or a student? No.
No,
that would,
that's a nightmare.
Okay, so it could just be a teacher or a student could say, there's a medical reason I can't wear this mask, and that would be permissible? Well, you can't, I know, so that's what I'm asking. What does the enforcement of a mandatory mask policy look like?
I would have to work with principals in order to come up with a reasonable way to enforce the policy.
Okay.
And so,
That is true.
you know, we as administrators in schools, we've dealt with issues where people are non-compliant, either with not wearing their ID, not wearing, and so obviously we're not interested in being harsh to people, but at the same time, we're interested in fulfilling the policy. And so using a reasonable measured judgment in a situation like this is really the order of the day.
Right.
There have been families that we've heard from who have said, if you require a mask, if you mandate a mask, we will not be coming here.
No.
And
They can do
it's
they
easy
should
for,
do
it's
virtual.
easy for people to say, well, then they shouldn't be here. But that's not what public education's about either.
Right.
Well, they have they have other choices.
They do have other choices, but if the parent is a teacher as well,
So can I ask for
I mean, there's,
clarification from the board? So one of the things that I've seen in various emails that I've gotten has to do with the age of the learner. So, you know, what you set forth, and that I know Mr. Bickner's going to do an awesome job writing, is,
this is hard.
you know, one issue potentially is K through 3, or where does that go, you know, for a younger learner? So I don't know if the board has any thoughts on that, but that was something that I've seen in several emails, and I'd like clarification from Mr. Bickner.
I know the American Academy of Pediatrics had a statement about that. They said these are some guidelines we should keep in mind when crafting policy about reopening schools. And I think they said K2, that you shouldn't implement face masks for K2.
Did they recommend a face shield for K2?
I don't think so. I think
remember-
they just said distancing.
The distance.
I think so.
when I looked at the different districts around the state and took a poll, there were some that delineated between K2 and 312, but the way that they delineated it was to use face shields for K2 and masks for 312, except one district, and I think it was Pinellas, and they were delineating it by keeping those children that are in K2 within their cohorts, that there is no commingling of classes, and that way it limited the contacts, it limited the likelihood that there's going to be any kind of intermingling or spreading of any. It's sort of like putting you on a desert island and saying, okay, this is, you know, welcome to Australia. But that's what they've done.
So what do you recommend?
What do I recommend?
Yeah, how should we word it, or what do you recommend? Any
It
suggestions?
depends on what the board tells me they want to do. If they want to limit it so that you don't have, or that you make masks for K2 to be a recommendation, strong recommendation, but not a mandate, or if you want them to be isolated in their classrooms and cohorts so that they're not throughout the schools? That's something that I don't know. I'm not an educator. I'm just a lawyer.
All right, Mr. Brodsky, that falls on you. You're the new expert. What do you recommend in this case with the little ones?
So I think it's challenging with little ones, and so I've heard several of you, make comments to the little ones and what to do. I know that other districts, the problem with the face shield is that what we're hearing from our own medical people is that that doesn't work, right? So there really is no great answer for that age. I bring it up because that is a dilemma, what to do. And so I'm asking the policymakers.
I would just say, let's refer back to the American Academy of Pediatrics. They're the experts on children and their health care. And part of what they reference also is that I'm trying to remember. I need to pull up the document and just read it. Maybe that's what we should do is before we really get into specific language, let's review what the Pediatrics Association recommends and come back to the table to talk about it.
And it's frustrating because if we do a blanket mandate, and then all of a sudden we're going to have
And you start making
42
exceptions. Right.
Right.
It goes back to perhaps
Personal choice.
personal or strongly
Strongly
recommend.
recommended.
Yeah, right.
But
Ms. Gilhousen said.
if we're not covered, I mean.
Because essentially, if you're just going to let anybody say, I'm not wearing a face mask
then
because
you're-
of my
then
personal
you're
reasons,
defeating
then,
the purpose.
right,
Yes, and as soon as you have one,
right,
then you're,
exactly.
Yeah, this is a hard one.
It is hard.
Can
And
we-
I think what makes it even more difficult is while you could consider it part of your dress code, it really is a healthcare intervention. It's not a piece of clothing. So to compare the two, I think it's apples and oranges. And I know as a parent, I want to have choices in my children's healthcare. And I think that we all feel that way, that, we all have very strong opinions about what's best for us and our families. And to take that freedom away from another person to make their own responsible choices, and we can give guidance and strongly urge and educate, but I have a hard time forcing it.
vaccines or anything.
Right.
So what I'm hearing, and correct me if I'm wrong, is that you want to strongly recommend for K2, but mandate from 3-12. Does that make
That's
sense?
not what I'm saying.
That-
I
that
would
would
rather
make-
strongly recommend for everybody.
Okay.
But the board members,
And Ms. Gilhousen brings up a good point, talking about the dress code with, if we're, eventually down the road, some kid's going to come with a mask that has some language or pictures on it that we are not going to like.
Right.
We're an A district, is what she has on, an A district.
we are an A district.
Well, I even think
Has
about
nothing to do
in
with Alabama.
kindergarten or first grade, they'll have character masks and they'll be on the playground and say, hey, you want to trade my Batman for your Superman?
Right.
So, I think,
Baseball cards.
yeah, that's a really difficult, when we've mandated it, we're responsible for how it's implemented.
And then what are we going to do? We're going to have disciplines because students went to school and refused to wear their mask, and teacher says, put your mask on, and then they get into an argument, and next thing, we're going to be expelling,
No, just send them
Well-
home, just send them home.
Right.
Just send them home is easy, I mean, it's easy to say, but they don't.
There may not
they
be a
may not
parent to
be
come pick
able
them
to go
up.
home.
And
Because
I'll tell you this also in the
access.
American Academy of Pediatrics article that I guess Ms. Bola and I both read. It talks about the what we need to consider first and foremost is that children are safe when they're at school. And there are germs, yes, there's germs every year, and this is a scary germ, but truthfully, it's not as scary for children as it is for older people. But there are a lot of children who home is not an environment that's safe. And so if they're coming to school and they're not prepared for the school day because they don't have a mask or what about the children who don't have a washing machine? So they have this cloth face mask that never gets washed. I mean, there's so many considerations to put into play that I have such a hard time forcing it on every child.
May I make a recommendation first?
Yes.
from what I've heard from 4 of you is you're in favor of a mandate. What I've heard from 1 of you is you're not in favor of a mandate under any circumstance. The biggest issue seems to be with the K2 level. What I would ask you to let me do is craft something that makes it a mandate for 3 through 12, makes it a recommendation for K through 2. I understand your argument that you should be able to impose whatever you want on your children and no one else should be able to do that. However, we are in a situation where what you impose on your children is bumping into my children. And so that is impacting the children for all of the rest of these people out here. And so just like when you're required to have inoculation so that you have herd immunity, so that you don't give the measles to someone else at the school, I think that it's one of those things that you can impose except under religious circumstances. Now, there also are medical reasons why you can't do those things, and that's what we should consider as well. My suggestion is, since you've already taken the leap, is allow me to craft something that does what I say, highly recommended for K2, mandatory for 3 through 12. These are the exceptions and exemptions and how you handle those things. And I'll send it to you by Tuesday of next week. That'll be my absolute goal, and see what you think.
And we may need to add an exception as one of those and any other reason that we see fit. Because other things are going to arise. It's like a job description. Anything else the superintendent sees fit.
One of the things that I was going to suggest that you make sure goes into this document when all is said and done is a section that says, and they did this in Miami-Dade, that authorizes the superintendent to make any adjustments necessary to protect the health, safety, and welfare of students and staff. Because it's like I said, the only thing that's certain in this whole process is its uncertainty. And so as it goes along, the bumps and changes and glitches and the different things that are going to come from the health department, because they are. I mean, if you look at it, what the best minds said 12 weeks ago and compare them to what the best minds say today, the Anthony Fauci's of the world, those people that are epidemiologists and know all of the stuff there is to know, they're changing and evolving as they learn the disease. And so as those things evolve and come from the Department of Health, which is what Commissioner Corcoran recognized as being the controlling factor, is our own Department of Health. As those things change, the superintendent's going to need to have the latitude to make exceptions and to manipulate and massage the process. Otherwise, every time you hit a brick wall, you're going to have to regroup and try again. And so that's my recommendation, is that you do that. When I read that from Miami-Dade, from Mindy McNichol, who some of you know, who's just an incredibly interesting person, I was just like, well, that's the simplest solution I can think of. And it works. And I think it's important that we do that. But that's up to y'all to do or not do.
So would we meet our timeline of submitting?
I'm sorry?
Are we going to meet the timeline of the 31st to submit?
Well, it'll be an emergency. Remember, he explained
Item on the 28th,
Right.
on the 28th meeting?
We can
And then we'll-
advertise for the 28th meeting and then handle it as an emergency and do the
Can we
backup
include that
48
in the
hours ahead.
trim, with the trim meeting? Can we include this on the trim?
It's an
We-
emergency item, so it could be either.
Yeah, we have a meeting that's set for 5 o'clock on the 28th. There's a workshop at 3 o'clock and a meeting at 5 o'clock.
Right.
And so you'd put this on the 5 o'clock meeting?
Yes, ma'am.
Okay.
So, Mr. Brodsky, I'm asking you one more time. Is this your recommendation that we go forward and set this in your reopening plan, that mandatory mask for 3 through 12 and strongly recommended for K through 2?
I think that the board attorney has already said that it's necessary to be in there. And so the
Wow.
board's policy.
You will not say yes, that's your recommendation.
It's your
That's what I want to
purview, Ms.
hear.
Karakis.
Oh, but Mr. Brodsky, I'm going to do you like I did Ms. Studdard, say, I do.
Okay.
Because it will come back to us and have to have your recommendation on it.
Okay.
And it will have to say, the superintendent recommends. So that's
Okay.
what I want to hear.
I have been getting signals up here that we need about a.
Wait, before
10
you give a bathroom break, I have one other question. On the school calendar, since we have all given consensus that we're going to change the start date to the 24th, do you think you can extend the time that the parents get their survey back or
Yeah.
their choice and give them some extra time so
Right.
parents don't have to choose by the 16th?
Right.
Is that even feasible, or is that,
Whatever.
We still got a time frame.
I mean, if it creates an issue, then by all means, don't. But I know so many parents are waiting.
We're trying to
I
to
make
hear what we
plans.
say today.
I would want them in by the 16th so that we could, in fact, do the
Okay.
things that we need to do to make that happen. I'm not going to chastise somebody that turned it in past midnight on the 16th.
Okay,
All
I
right,
have been
thank you.
requested, we're gonna have a 10-minute break. We'll come back and talk about temperature checks, and then we're gonna get into questions. Okay, 10 minutes, everybody. I noticed several of you went out to get jackets, and they have turned the air up. So how long does it take for it to warm up to where we are unfrozen? Hey, I just, oh my gosh. I went outside and it was like heaven. Oh, okay. We'll restart the workshop. All right, we've gone through the mask, we've gone through the calendar, temperature checks. What's the feeling of the board? Or do you want to require temperature checks? Ms. Gilhousen, we'll start with you.
Well, I think just based on what we heard from the health department, it sounds like there's so many other ways to screen for COVID, and temperature checks seem to be, even from their perspective, not the most effective. So given the cost and the time that it would take and the manpower to do it effectively, plus train all of our employees. And then I didn't realize we had to keep a log and then put that in.
That's how that.
Yeah, that's, I can tell you as a nurse who used to do paper charting, that's a big undertaking, so.
Okay. So you don't think it's good? Okay, Ms. Karakis?
I'm the opposite, although I've talked to Mr. Brodsky, I've shared it with all of you at the last board meeting. You're all aware that I just, it's like the masks. I feel like we need to do everything we possibly can to keep our students and our staff safe. And if, wearing a mask is going to help, or if having somebody's temperature checked and seeing that at this moment they are, and isolate them until they can be removed or picked up, if that prevents the spread. I mean, I know there's possibility that they could have exposed people already if they did have it, but if we can prevent it from being spread even further, I for one am in favor of that. And like I said, I believe nobody should enter the school unless we've done the check on them, and I think we should have, again, I'm going to say hire monitors, aides, the people who are going to do the temperature checks can also watch the kids in the classroom during the lunch break and not use the cafeteria. But I believe that we certainly should do everything in our power to keep them as safe as possible. And if that means temperature checks along with masks, then we should do it.
Okay, Ms. Bullock?
Well, I just think that's kind of an impossible thing when you have, a size of oak leaf and that kind of thing. I mean, we're going to spend all day taking care of all these things, and they'll never get into class to be educated. But however, I would like to have that available to us. So if a bus driver or a teacher says, such and such, I think he doesn't feel good, and send them right down. And then the clinic would have obviously those
Right.
temperature checks and that kind of thing, so they could be checked,
Yeah.
especially since we're going to have two separate spaces for the help for a kid who just has a skinned knee as opposed to a kid who we're concerned with the coronavirus.
And
Okay.
let me be clear, I don't think we shouldn't, I'm not saying we shouldn't check any temperatures. I just don't
Yeah.
think it should be a
Right.
screening. It should be
For
a-
every day,
if
for
you're-
every
if you
class.
have symptoms.
And like Ms.
yeah.
Bullock said, it would
Right.
be, that's really taking time away from classroom.
Well, I'm
Ms.
just
Bullock?
thinking, can I add something to what Ms. Bullock said? I'm just thinking, take Oakleaf High School. The kids all come in, and one kid does come to school who may have a temperature, who has it, and he's come in contact with 7 periods worth of kids. How are we as a board going to feel when one of those kids go home, get really sick, have it, and God forbid something happens where they're no longer one of our students?
Well, if they've got a
Or
mask
their-
on, they should be
Or
protected.
their parent, or their grandparent, because they're going to carry it home.
Yeah.
So just keep that in the back of your mind, that they're going
Yeah.
to transmit this.
Okay, Ms. Bola?
Furthermore, keep in the back of your, Furthermore, keep in the back of your mind that once anyone, a teacher, student, custodian, whomever, presents a temperature, generally that's after the first, second, or third day of having this. So they've already exposed everyone, whether they have a temperature or not. And at that stage, I don't know that a temperature check on a daily basis of every child coming in is going to be feasible, since I'm not trying to make light of it, it's just, it is one of the aspects of this disease that comes later. And by then, many, many children have already been exposed, and if we didn't do the mask right, or if we didn't do the temperature right, or if we didn't do whatever right, we're going to be responsible for all of those children. We're responsible for all of the children.
We
And
are.
the teachers.
We
So
are.
and we want to keep it as safe as possible. However, we also want to be able to educate these kids. They're coming back to school And that social emotional side is just as important for being there. So
Yeah.
I'm not necessarily in favor of it.
Okay, so three of you.
Three.
Of you.
I'm in favor of it 100%.
I
She
I
just
said
changed
three.
to three.
Three don't think that temperature checks for every kid every day is what they would like to do. One doesn't.
Can I add one quick thing? Sorry. But one of the reasons that I was very much in favor of postponing the start date and increasing the number of days that we have for training our teachers is to also train our teachers to understand and be able to, for want of a better word, acknowledge the fact that a child may be ill and send them to the clinic, as Ms. Bullock said, because a lot of times, particularly new teachers, may not necessarily be able to look at a kid and say, ooh, they look a little bit
Something's a little
tired, or
bit off,
something's
yeah.
not quite right, whatever, but to help them learn some of the things that they need to be looking for.
Okay. Well, I agree with three of you. I think, temperature checks, I felt very strongly about masks. I'm not going to fall on the sword on temperature checks one way or the other, but I think so many of the people are asymptomatic and wouldn't be running a fever, and they're carriers. I think that if we can get the mask and get the cleaning, that if there's if teacher feels that Susie or Johnny are a little bit off or they're not feeling good, they can go get them checked then. But I'm not sure it's worth doing to every student every day. I mean, by the time we get through all the cleaning and temperature checks and hunting their masks that fell on the floor, I mean, they've got to have some time to teach the kids too. So anyway, so it sounds like temperature checks are a no-go. Now, the next thing is questions from the audience. Okay, before we do, Ms. Kidwell had asked to speak from CCEA. And then we'll go to the questions.
Now can you hear me?
Yes.
I'm going to do this just because I just went outside and it was really steamy and it felt great.
Yeah.
But now I'm all fogged up. All right. My name is Victoria Kidwell and my address is on file. I want to thank you for the opportunity to speak to you today and have you listen. As the incoming president of the Clay County Teachers Association, I have a very monumental responsibility of advocating for our educators in Clay. And I feel a great weight, and it tears at my heart when I think of all the personal stories that our educators have sent to me. And I know you've been getting those emails too. They're struggling with the real risks of returning to school, and we owe it to them to get it right. They're counting on us to protect them. And first and foremost, we can't turn away from that duty because it's hard. We have to do it. Most teachers and students want to return to school. We know students learn better in a classroom with a great teacher. But when we return, we must utilize every safety measure proven to make that return safe. It's not enough to say kids need to be in school. Instead, we have to plan for students and teachers to remain in school, learning and growing in the knowledge that we beat this together. The CDC has gained a lot of knowledge about this new virus in the months our country has been battling it, and they know the measures that help contain and prevent the spread of this virus, and we all know them too. The protocols are well known: social distancing of at least 6 feet, wearing face coverings in public, and hand washing, cleaning, and disinfecting. These are the things that help our students and staff stay healthy, and these are the things that are going to keep our schools open. There are many roadblocks to safely reopening schools during a pandemic, but in my opinion, the most damaging one is the mindset, oh, we can't do that. When schools were shut down in March and we went virtual without a day's notice, teachers didn't wring their hands or give up and say, we can't do that. Teachers said, let's figure out a way to do that. And they did. Now we have some big problems and we've got to solve them. And we need leaders who can help us solve them. We need leaders that are courageous and can step up. I've talked to a lot of people, and let me tell you, we're very fortunate in Clay. We have great leaders in this county. Leaders who say, let's figure out how to do that. Social distancing. We need to limit our class sizes so students and teachers can socially distance in a room where they might have to spend 7 hours in elementary. Please don't say we can't do that. Cleaning and sanitizing. We need enhanced cleaning throughout the day, adequate supplies of soap, hand sanitizer, paper towels for every room, filters on our old HVAC systems that can help contain any airborne virus, fresh air circulating in our rooms, and practice of being outside more in the fresh air. I know we have a hard time finding custodians. We have to say we've got to figure out a way to get this done. Wearing face coverings. That's become so political. It shouldn't be. It's public health. The CDC says to have students and teachers wear face coverings when they cannot social distance. That's what it says. We know it works. Please, please, please don't say we can't do that. It's too hard. It's too political. We can't enforce that. It would be a nightmare. Just let's figure out how to make it work. We can do it. Hillsborough, St. John's, Leon, West Palm, Duval, Miami-Dade, and Monroe counties are all figuring out how to make it work. Clay can do it too. We can make a mask policy. Yes, we have diverse learners. Yes, we have to make accommodations sometimes. But that doesn't mean that we can't make a policy. It doesn't mean that we can't make it get done. We can do it. Our children and staff will have prolonged exposure, hours to each other. They will be at great risk unless our leaders step up and say, we've got to figure out a way to do this. We cannot do things the old way. We need additional time to figure all this out. We must plan every scenario and be ready to deal with it when it arrives. I have 13 pages of questions.
What?
There is no way I could write these questions on cards, and there's no way that you could address them all here.
Yeah.
We need time to figure out the answer to every one of these questions. They're valid, and they've got to be dealt with. Teachers are ready to help figure out how to do this. You need to be ready to help figure out how to do this too. We all know the statistics, and I have them if you don't. But now, I really want you to hear some personal stories from some of our teachers that are tearing at my heart. I want you to feel the risk they feel, the thing that keeps me up at night. We cannot fail them. Spouses. You're not just saying the kids and staff are safe. You're saying the families of the kids and staff are safe because the kids are going to take it home. Teachers are going to take it home. We have so many teachers that are caregivers, so many teachers that take care of their elderly parents, have immune-compromised children, have people in their house that they can't afford to get sick. Real people with real fears and real risk. We have to feel that. From a teacher at Fleming Island High School. People who know that I'm a teacher have been sharing their concerns about their children and the overwhelming anxiety many of their children, some of these children as young as elementary age, are having over the absolute fear of returning to school, while we still do not know enough about this virus to cure it in the slight. I love teaching and I truly miss being in the classroom. I hope that teaching face-to-face is what I can do. I just want to be safe and I want my students to be safe. Dr. Inlet Elementary. I've been teaching in Clay County for 14 years. The past 12, I've been teaching gifted students, 70 of them. This current school year plan is for the gifted students to be placed in varying cohorts across the grade level. That means I'm going to be with students from different cohorts in my room each week together. That means I'm being exposed to the students of all the cohorts in all the grade levels, and exposing me to every cohort in the school. I have severe asthma, and I have almost my entire life. I take medication every day for it. It does not appear there's a plan to have my gifted class be taught virtually. The only safe way for me to return to school is to require a mask in my room and provide as much social distancing as possible. Oak Leaf High School. As one of the district's many at-risk teachers and a caregiver to my elderly parent, I'm very, very concerned. Since we began lockdown, I have limited my exposure by staying home. When school begins, I will not be able to continue this, and I must teach these ACE courses. I can either choose to teach a different course online through Clay Virtual and leave these students to an untrained teacher, or risk my health and possibly my life by teaching in the classroom. I chose the classroom because my kids need an experienced teacher. Even if I have health issues, I know that these ACE kids also have health issues too. I need my students to wear masks. I'll ask them to, but some might not. I need you to mandate masks so that I can have a safer learning environment for all of us, students and staff, and the families of students and staff. Special ed teacher. I'm worried and scared. I can't die. My adoption case has been postponed. Clay County's not having hearings. My spouse has no right to my children. Nothing can happen to me until there's legal paperwork tying my spouse to them. This fear has been on my mind since March 13th. It might sound extreme, but it's the heaviest weight I carry because it's my reality. The teacher's edition doesn't have the answer to this, and college didn't prepare me for this. I feel like a horrible human being having to choose between the lives of my family and my career. I can't lose my job because I'd lose everything. I love teaching special ed. It makes me a better human being. Is my job more important than the family, than the health of my family? Undeniably no. But my hands are forcibly tied, and no one should have to make this type of decision. I'm struggling with this and a deadline that's approaching faster than I can process it. Elementary school child, Coppergate. From Coppergate Elementary School of Arts. I'm going to explain my thinking about going to school. It's not just kids, but adults that get sick, and I worry about that a lot because I live with my grandparents. My granddad has type 1 diabetes, and he's over 60, so he is high risk. I also have a 1-year-old sister that could get it, and I would feel terrible if someone in my family got sick because I went to school. If it was a teacher who got sick, would we get a substitute, which I do not think is very good. Some pros about going to school is that you do get to see your friends, and you have stuff like PE that keeps your body healthy, and we get to meet and see our teachers and classmates. I would like it if we were required to wear a mask and use hand sanitizer and have soap in all the bathrooms, and not to attend if we don't feel well. That is it. I hope this helped you get a better idea of what kids might want to see and think about a lot. Every time I try to think about what is best to do, I feel horrible and I cry. There are so many things I worry about because I have so many questions. I want to go to school, but I want my family and my friends to be safe. Please, please do everything to keep them safe. No excuses. Just do it. We can get it done. We can do this.
Okay, next we'll go to the questions from the audience. Yeah, there may be some redundancies here. We'll try to clear, and then I have two that came in, or one that came in on the link. I'll get to that later. Okay. My hope is for the board to mandate masks for student and teacher safety in the classroom. If you, for whatever reason, decide not to mandate masks, will you at least support teachers with a class rule that masks must be worn in this classroom? I think we've already solved that.
I'd like to add something, though, based on that and what Ms. Kidwell just said. We just had, on our 10-minute, 5-minute break, a teacher came up to me and said he teaches second grade, and we're not mandating it for the little ones, and he's concerned because, and two teachers actually came up to us, the second one. They're concerned that they're going to be teaching with 18 children that do not have a mask on.
Yep.
So does this board want to discuss it?
Well, I told you how I felt to start with, and then I still think everybody ought to have a mask, but that's up to the majority of the board. Does anyone else want to reconsider? Okay. If masks are mandated, will the student code of conduct be updated for enforcement? Yeah, we've answered that. Okay.
Well, repeat the answer, that it would be part of the.
It would go into the opening school plan.
Oh, this one is from, well, this person was Bob Wilson. Then Betsy Rager, I'm not asking y'all to come up, I'm just gonna read this about date of opening. We're through with that one. Okay. Oh, this is going well. Okay. This one doesn't have a name. It says, what data research are you using to base your decision on not requiring a mask? That doesn't count anymore. I don't mind coming back, but don't feel safe without a mask requirement. Okay. This one is Evan Gould. Is he still here? Okay. Exactly what research or expert opinion are you using to make your decisions regarding social distancing and masks? Okay, he was here. Okay. CDC, Florida Department of Health, the Surgeon General. I think we've pretty much covered that one. No name. Follow CDC. We are required to social distance and wear masks to this meeting to protect you. Why are we not following the same requirements in our classrooms to keep us safe? I think we've taken care of that. This is Jamie Beck. How are our substitute teachers going to be cleared? I will start the year with a permanent sub. Will they know the procedure of our school prior to the start? When plans are finalized, my FMLA will already, can you help me? I can't read it. Will have already started. I am scared for my students. You want to address?
I can address the substitute piece of that.
Okay.
I've talked to Tina Mosley, who is in charge of Kelly Subs.
Okay.
We recognize that coming back in this environment is different, and so we're going to have to train substitutes to come in. There is no doubt that a great many things need to occur. The pool of people that are out there, and of course, keep in mind this is a pool of people. This doesn't mean that it's guaranteed, is 625 individuals. So a big concern that I have, like even when we start school, is going to be, absences of teachers related to issues involving this situation. And so that 625, what's the real number? I don't know, if you kind of catch what I'm saying. So, I feel like there's a group of people, and we'll move forward.
Okay. Next question from Amy Ferris. Do teachers only get 80 hours of COVID leave even if they contract it more than once?
So my understanding, and Ms. Troutman's the expert in this whole thing, would be that it's up to 80 hours by the law. Is that correct? Okay.
If they can contract it more than once, what?
According to the Families Coronavirus Act, it simply says up to 80 hours.
Okay. So, okay. Next question. What makes it safe for us to come back based on What data makes it safer for us to come back? Well, we kind of, okay. From Ted Buzinski, if a teacher chooses virtual, do they give up this position or is this a temporary assignment? Part 2, distancing arrow, greatest possible extent, what is the distance we should separate students? CDC says 6 feet. So we've talked about the distance. If they choose virtual, do they give up their position or is this a temporary assignment?
So one of the great challenges of this is I showed you or demonstrated the fact that you have, really, you're opening up 3 different schools, right? So it's like we built 3 schools and we're coming into the new school year. So the staffing of all of that is going to create some challenges. Obviously, there's going to be teachers that are going to want to request virtual, and there's teachers that want brick and mortar and teachers that want the online version, and I get all that. When the student data comes in, like what are students choosing, then of course, there is going to take some negotiation with our teachers union as well as an MOU as to the process for the placement of those teachers. So some of the challenges that are involved are teachers that are medically fragile or immune compromised, and how to do that in a way to make it work to the greatest extent possible. And so that's the commitment. Ms. Kidwell knows that that's the commitment. Now, the truth's going to be in the details once all the numbers come in, which is why we're trying to get the parents to commit to an option.
Okay. This question is from Stephanie Bosheri. Where are you? Is she gone? Okay. When a student is sent home from contact tracing, how will you continue to educate them so they don't fall behind in each specific class, i.e. AP Human Anatomy?
So the challenge is going to be how to do that if we have multiple students being absent. Well, you know that when a student is absent, we always provided assignments. We've always done that. There's no doubt this is different, though. This is a whole different situation with so many people. And so I would argue that that's something that still needs to be discussed as to how to do that. My expectation would be that the teacher is going to provide the work for the student and attempt to help the student to the best of their ability. One of the challenges that I've seen with other districts model, if you will, was that there are actually some districts that are having teachers both do distance learning and brick and mortar learning at the same time. And I don't know how you would do that as a teacher. And so there are still details to be worked out on that issue, but we're aware of the issue.
Part B of this question, what happens with their siblings who go to a different school? Do they also have to stay home?
The way I would answer that, and of course I would consult with the health department about how to handle that situation, but it would appear to me that if there was prolonged exposure, 15 minutes of less than 6 feet, based on what I heard on our little video, that child would be quarantined too.
Really? Okay.
But I think it's important to say that the quarantine order doesn't come from the school. That
Right,
the
right.
health department
Nope.
would decide who is quarantined and for how long.
Exactly.
Right. What happens if a student, teacher, or administrator tests positive?
They'd be contacted by the health department, and they'd be most likely, based on what we heard, told to stay 14 days in self-isolation, let's use that term.
Can I ask a question about that? So, down at the district office, if there's somebody in one department, I'm just going to say maintenance, I don't know. If someone in maintenance comes down with it and tests positive, are they notifying the rest of the maintenance department? I mean, I know we can't say John Smith has, but.
So we of course can't release the private information. The health department would use contact tracing and notify the individuals who've been identified as having prolonged exposure, which they defined as 15 minutes, 6 feet or less than 6 feet.
So it's all through the health department. It wouldn't be someone from maintenance admin would say,
No,
somebody
one of
has
the,
everybody.
one of the
if you get-
challenges is gonna be is that, this is a small town
I know.
and people talk. And so then that creates the confusion of that. I can just tell you, and Miss Dennis can testify, because Miss Dennis is the contact of Miss Huffman. So the order would be, if something were to happen, that Miss Dennis would ultimately be making the call to Miss Huffman,
Okay.
right? Because otherwise, 50 people are calling Miss Huffman,
Right.
and she's trying to manage this situation. The issue is that people take it upon themselves to say various things, which creates all
Right.
kinds of angst among all kinds of people.
So, for the chain of contact, is it the health department who keeps a log of that, or is Ms. Dennis the one who's doing it on
It
our
would be
end?
the health department.
Okay, thank you.
Okay?
So, from what I understand, if a child were sick in a classroom or a teacher from a classroom were sick, they're not going to quarantine the whole class. It would
That
just
would-
be,
That would be what she said, yes.
they would quarantine the whole
No.
class. No, just those
Those
individuals.
people
who,
that have
okay.
had,
That were,
which
that's
And
why
was,
that's
they wanted the
regardless of
seating
face
charts.
mask or not. Even if you had a
Correct.
face mask on,
Correct.
if you were closer than 6 feet, then you still have, okay.
She said that's why they wanted the seating charts, so they could see who was in the danger
Right.
zone.
Right.
That seems
Okay.
like it's going to be a hard thing to track with
Yeah.
little ones.
it absolutely is.
Yeah, I mean, if they're out on the playground, they're running around in PE class or whatever, that's going to be a hard one to track.
If someone in the classroom tests positive, does the whole class go home for quarantine time?
I think we answered
Okay.
that one.
Okay, let's see, that one didn't have a name. Catherine Morrison. In classrooms with no windows, are we going to be able to keep the doors open? I assume they're talking about portables. No? Regular classrooms, okay.
Yeah, because of the
Are you going to be
security.
able to keep the doors open?
So that is a great question. We've asked DOE if in fact that's going to be relieved. At this point, the answer is no, but we're not to this point where we're going to say that that's the final word. Of course, there's competing forces. There's the safety and the Marjorie Stoneman Douglas Act and all of those things now competing with this situation and what to do with that. I don't know.
And we've had a lot of comments too about the portables. That the air conditioner doesn't have the whatever kind of filter, whatever, and that I don't know what we can do about that because they can't leave the doors open either.
So it's my understanding, and I'll deflect to Bryce, but there's the filter.
Ms. Ellis?
The unit could not use that particular filter, was what I gathered.
Yes, can you hear me? Can you hear me? It's not designed to use the HEPA filters. It has a tighter weave, the HEPA filter, and the unit cannot handle it. It'll stress the unit.
Oh, okay. Rats. Okay. Okay. What flexibility is going to be had in regards to attendance? Considering parents are to hold out children for 72 hours if they are running a fever.
So yeah, it's a great question. The flexibility of student attendance and how we deal with that issue, given the fact that we're in a pandemic, is something that needs to be addressed. I don't have an answer. Is what I'm
Okay.
saying.
We don't know yet.
But clearly there
That's a
needs to
good-
be exceptions based on this scenario.
I mean, geez.
That's a school board policy, isn't it? The attendance policy, wouldn't that be something that the board would need to look at?
Yeah.
I would think that's something we need to put on our agenda.
Yeah, okay.
As part of the reopening as well.
Mhm.
Okay.
And it may, not to change our policy, our
There you
overall
go.
policy for
Right.
years,
Yeah.
but
during a
to make
pandemic, this
a
is
separate
our
policy for
absentee
this
policy.
particular situation.
Ms. Honora, be sure that stays in the play, okay? This is from Nicole Honor. Why are daily screening protocols only recommended and not something school health personnel are conducting? By the way, Keystone Heights High School still needs a school nurse according to the job board. Would you like to comment on that?
Yeah, there's no doubt that the goal would be to have a nurse in place in every school and every custodial position hired and additional custodial positions hired. The first part of that question was again?
Why are daily screening protocols only recommended and not something school health personnel are
So
conducting?
that's the thermometer check.
Okay. Okay.
So
This is from P. Schaefer. Today, you limited public access due to social distancing. How can a classroom with 30 students have 6 feet social distance?
one of the things we want to do is look at every single space, whether it's a classroom, cafeteria, and get the maximum amount of social distancing possible, which should be 6 feet.
Okay.
High school. But we're just gonna-
I wish to address the board, here's a name, Robin Repper. And there's writing on the front and back. I wish to address the board, explain the safety protocols and currently in place at my school. We need questions answered. Explain the terms of the choices teacher and support staff are being asked to make. 165 and older respiratory underlying condition, support staff, special needs. We have been asked to make a decision our contracts within the next 48 hours. We need answers on the 4 choices we have been given. We need advice, and there's a phone number, Robin Repper.
I'd happy to call her too.
Okay.
So what I would say is that employees were given the option or were asked their intent. Are they coming back to work? Are you not coming back to work, like retiring or resigning? Or are you going to take some sort of leave that would enable the district to figure out how to staff all of the various jobs that they have? Oh, I'm sorry. And I will give you a call later since your phone number's on here too, in case we miscommunicate. Yes,
Right.
ma'am. Yes, ma'am. If I don't answer it now, I'll call.
Okay.
Okay.
We can't do this.
I will definitely call you regardless of this answer, okay?
Mr. Brodsky's going to call you.
So,
Okay.
so the 4 choices were, are you, I'm assuming, what position do you have, ma'am? Okay. So essentially, the choices were whether or not you're going to come back, or you're going to use leave, or retire. That gives us an idea of who is coming back in order to staff people. As far as the medical part of this, like a person with a compromised system and all of that, we need to negotiate with the 2 unions in order to determine how to handle that situation. In addition, of course, there's laws related to this that we have to follow. So, but I'll call you and we can talk more about it, but that would be a good general answer for right now.
Okay. Well, that finishes the cards. Now, I did we did have some submitted to our secretary. The first one, Melinda Franklin Corpus, it was a comment and no question, so don't know what that was. Next is from Michelle DeRouse. She's got 5 questions. If a student or teacher tests positive in a classroom, what are the plans for disseminating information to other students and what actions will be taken? I believe we have covered that. Will the teacher and other students in the classroom also have to get tested and quarantined for 14 days? We've been there. Will there be a substitute?
Yes.
Yes. Will the teacher be removed from just the one class with infection or from all of the classes taught throughout the day?
See, I think she's referring to her student gets it with a, it sounded like, I'm not sure.
So,
it says-
Yeah.
my understanding, based on what I heard, would be that they would do contact tracing to determine whether or not prolonged exposure had occurred, and then make a decision from there.
Okay. Yeah, the last one isn't a question, and that ends that. Superintendent comments. Do you
Oh,
have any more comments?
No, I would just say this, just real quickly. You know, one, I greatly appreciate everybody that's here in the audience. I greatly appreciate the board, and I think everyone realizes the seriousness of the situation, and certainly I feel the weight of this. So if anybody was thinking that I slept, that's not the case. It's a tremendous responsibility, and I appreciate the professionalism of today and the way we attempted to come up with solutions. I also, I appreciate everyone's patience out there related to this. The answer is that we don't have all the answers. And I don't think there's any harm in saying that and admitting that.
That's true.
Even the person in charge of the health department has said that to you. And so we just have to be patient with one another and work through all of these issues, because there'll be additional things that are going to come up along the way. And so I just appreciate everybody's professionalism today.
Okay. Mr. Bickner, you're not on the agenda, but do you have any comments? Okay. School board comments. I'll start. Ms. Karakis.
I'd be happy to go.
I'd be happy to go first, thank you. So, Mr. Brodsky, we have now mandated masks for grades 3 and up in our district office. So will we be able to put some signs up down at the district office on every door saying, do not enter without your mask, or a sign mask required, or something along that lines?
We can certainly communicate with all employees what the expectation is, that they're going to wear a mask if they're within 6 feet.
Well, I'm thinking people who come into the district office for
Oh, at the front door?
pre-employment,
At the
stuff
front
like
door,
that.
yeah, we can do that.
Okay, very good. I'd like to ask Ms. Troutman, Ms. Ferris's question about the 80 hours for the COVID leave. You said that according to, I forget what you called the Act, Family Act, that it just says, is there any way of checking to see if it's per occurrence? And let us know, and you can just email that back to us.
Okay.
Thank you. I'm curious to know, after she asked that, God forbid somebody does catch it more than once. We want to make sure that they have that paid leave time and they're not having to use their sick or vacation. Again, I'm going back to class size. I know we're not expecting as many students to come back, but any classes that seem to be, if we can't space them out, I would really like us to look at maybe somehow reducing it. And I'm not saying set a policy on class size reduction or anything like that, but I just want us to be really aware of it. And if there's any way possible to, shift and move however you can to have the fewest students in each class and have it distributed evenly. And I know you're looking at that, and I know your team is on top of that. We did get one email, we got many emails, but one in particular referenced the Take Stock in Children's Mentors, and that goes towards part of their, Mrs. Stutter, this was probably on your list.
I've already talked to Mr. Brodsky
things to
about
talk
it. In
to
fact,
about.
I was going to bring it up
Okay,
when
so
my turn came.
fill us in on that, on what we're doing. I know it's a closed school right now.
So one of the things that we put into the plan was the idea that a closed school should occur, which means, limiting visitation to the school. And that just seemed like a sound strategy. If the board, we want to make an exception for this particular program because of the academic nature and the mentoring portion of that, we can certainly do that.
And their funding
I just
comes
think that a group of people trying to figure out the best plan possible, that just seemed like a reasonable strategy, not taking into account
Yeah.
these kinds
This-
of
Well,
this
these
is
things come
crucial.
up, these kind of things are going to come up, and so
Right.
we just have to
Right.
address them.
Maybe what you could do is have a designated spot where they go instead of meeting them in the cafeteria or wherever. Maybe have a designated spot that they can meet those students.
Yes, ma'am.
On pretty days, they could go outside or
Yeah,
something.
that would be the ideal thing.
I haven't had a chance to, Ms. Cook called me today, and I told her to send that email out
Yeah.
to Mr. Brodsky and the board because I hadn't gone through all the details, but she was explaining to me about the funding for
funding.
Take Stock and so forth, and this is the scholarship program.
Yeah.
So then, when I got here, well, I don't want to take
You're
your
fine,
thunder.
you're
I'll come
fine.
back to you.
You can keep
But I even
explaining it.
asked him, like, several churches and the Rotary Club, all mentor, and I said, and the other night at the Dairy Queen, a lady asked me, are we gonna be able to have mentors this year at my elementary school? And I asked Mr. Brodsky, and I said, what about, the churches and clubs and organizations that mentor? Are they going to be allowed to come and mentor kids?
I could maybe understand holding off on that
Yeah.
for now, but
For a
the
while.
Take Stock is different.
Right,
You
it
know,
is.
it's,
So we're gonna hold off on mentoring to start with?
So what I heard was you want Take Stock to participate, but to hold off on the others
Right.
because it
Because I'll
seems
go
like a
tell Rotary.
reasonable
Right.
policy to avoid
Yeah.
numbers of people.
Yeah.
It
Because I'll
doesn't
tell
seem-
Rotary because they'll be, pushing.
yeah.
So I will make sure they know.
It doesn't seem
And the
right to
churches.
say, oh, the mentors from the church or Rotary can come, but mom can't. You know, that doesn't
Yeah.
seem right, whereas
Yeah.
the Take Stock is a whole different program. It's an academic program that funding
It's
for those.
required.
It is required that they have that, so, if ever, you're okay with that
Yeah.
too? Yeah.
Okay.
Perfect. And my last thing, well, actually, I have two more. Dr. Legucco, we're talking about the start of the school year changing, and I'm sitting here thinking about health insurance and that coming out of each paycheck, and I just wanted to just put it out there that we need to look at that too. And then graduation on Friday night.
Question two.
So will the students be, I know the email that we received said everybody would have a mask. I'm wondering how we're going to do that, board members, will we all have our mask on? We
So,
obviously
so
not shaking
I'm going to
hands.
I'm going to wear my mask when I can't social distance.
Mm-hmm.
And then I'm going to remove the mask when I'm socially distant away.
Mm-hmm.
When it comes to the distribution of the diplomas, each school has a different plan.
Right.
I'm going to Orange Park High School, so I know that there's social distance in the chairs that are on the stage is what I'm
Right.
being told. And
I'll
so,
be there too.
And so you'll be at one
I'll
end.
keep my distance from
And
you.
my niece is
You're
graduating.
both at Orange Park?
Yes.
Oh, that's unusual to have a
Yeah.
superintendent.
I don't know how that.
Well, I requested it. My niece is graduating from there,
If I had done
so
it, I would have.
Who's at Oak Leaf? Miss Bola?
You're in Oak
You
Leaf?
have the biggest school, so you're at the most risk.
Where
Good
are
luck.
you, Miss Bullock?
Middleburg High School.
Where are you?
I have Keystone, the smallest
Okay.
one. Yeah.
I'm at Clay High.
Clay High, okay. Lemon Island doesn't have one of us
And
there.
Ridgeview. Who's at Ridgeview?
Ridgeview and Lemon Island. Is someone going?
yeah, there's someone going, yes.
I want
Well,
to,
that's all I had. Again, I just want to say thank you to your staff and all the hard work that went into this. And I know this was, 4 hours, but it was a good discussion.
yeah,
So thank you to all the board members. And
okay. Ms. Gilhousen?
Well, I just want to speak to, I know I was the minority when we're talking about face masks, and that was kind of the hot button issue here. So I just want to appreciate the discussion that we've had
Right.
about it. You know where I stand on it, but I want to work with you on the policy.
Right.
So, and I also want to reiterate to our teachers and the people who've emailed that are concerned about face masks, I certainly see both sides of
Right.
it. And it is an incredibly hard position to be in to make a decision that's going to affect so many people in so many different ways. And listening to the testimonies of teachers and parents who have vulnerable family members that they're responsible for, and the agonizing decisions that they're having to make, it's heart-wrenching. And so I wanted to make sure I said that and know that, while I have my own personal opinion about it, I want to be a part of the conversation.
Right. Thank you, Ms. Gilhousen. Ms. Bullock, who wants to go next?
Thank you. Just again, I appreciate everybody who sent us an email and, to tell us, what was happening and keeping us abreast, because we cannot understand each individual's school situation or each individual teacher situation. I appreciate that each school is going to develop a plan because every school is different. and shouldn't be a cookie cutter thing, and one school's issue may not be at another school. So I appreciate that very much. So thank you, and I guess I'll hear about graduation at Middleburg High School too. So thank you.
Okay, Ms. Bola.
I just wanted to thank everyone as well. Thank you all for being here tonight, for the show of support before the meeting. I think that's incredibly important to know that we're all in this together. This is not an us and them sort of situation. We have to come up with the answers that we can all appreciate, we can all live with, because that's our goal. We want to live together and support each other in this. It is, I know, as soon as we talk masks, if we thought we had a lot of emails up to this point, I'm certain we're going to get many, many more coming up between now and our next meeting. And this is not an easy decision for any of us to make, because I totally understand where Ms. Gilhousen's coming. And that's where I was leaning before Mr. Broski said, well, I hear that. Most of us feel this way. This is one of those situations where there are going to be exceptions, and it's going to be frustrating. It's hearing about the K through 2 kids. Yes, children can be taught how to wear a mask. That's not it. That's, and perhaps I'm waffling, I understand that, but perhaps by the time the policy comes before us, we may have more information. This has been a learning experience on a day-to-day, sometimes hourly basis. And you realize you're behind the 8 ball when you haven't heard something that's going on. Some of it has been incredibly critical. Some of it's been not as critical as others. So it's one of those situations. Please work with us. This is not a political situation. We're talking about the lives of our children, the lives of our employees. And that's what's most important here. And I just wanted to say thank you, Mr. Broski, for all that you've done since you stepped into this position. You've certainly stepped into it.
Don't throw me in this briar patch.
And we appreciate all that the subcommittees have done. The 13 subcommittees have been phenomenal. So thank you all very much.
Okay. Well, I'm really proud of the board tonight. We had good, open discussion. We can agree to disagree, but I understand. I think every one of us understands we all want to keep the kids safe. We just have different ways of thinking about it, but we were able to come together. And I do say, I hope that maybe we will look at that K through 2 again, but the majority rules, and I can live with it. Okay. I want to thank everybody for the hundreds of emails that we got. I apologize for not answering all of them. I really was trying, and finally I just gave up. There wasn't enough hours in the day to answer them other than saying thank you for writing, which says nothing. I wanted to personally respond to each one. Maybe I'll still get to answer them one of these days, hopefully. But I appreciate all of y'all coming tonight and caring enough about our kids. That's why you're here. You care about the kids, and we've got to all work together to do this. Mr. Broski, thank you for your leadership. I feel like we're going to get through this. I'm an optimist. We're going to get through this. There's going to be kinks as we go along, and we'll do a few tweaks here and there. But as we face them, the things that come up, we will handle it, and we'll do it in a good way, in a well thought out way. I'm very proud of all of our administrators and the committees that have met, and I know everybody would love to leave here and go home and eat dinner, and so with that, I will adjourn the meeting.